And couple of reminders for the members before we get started, and that is for anyone participating on Zoom, which I think is pretty much all of us, please keep your microphones on mute unless called upon to speak. Those participating by phone, please keep the phone on mute at all times unless called upon to speak, and do not put the phone on hold. Please avoid using speakerphone when speaking. Please speak directly into your device's microphone or your telephone receiver. I'm going to ask the secretary to please conduct the roll call.
Member Benham?
Present.
Member Cloutier? I see him. Member Alchandiri?
Present.
Member Gower?
Here.
Member Kavanaugh?
Here.
Member Lakin? Member Menard?
Good evening.
Member Pinel?
Présent.
Member Tilley?
Present.
Vice Chair Di Giovanni?
Present.
And Chair Egley.
Present.
You have quorum, Mr. Chair.
Thank you very much. We've received no regrets. So I'll explain some of the meeting procedures again as we're on Zoom. The following procedural guidelines are being implemented to promote orderly proceedings of this virtual meeting. Attendance, should members need to leave the meeting, and as I say, it could be a lengthy one, so people may need to take a break throughout the evening. They should advise verbally that they are doing so before clicking on leaving the meeting from the Zoom platform or ending their call if participating by telephone. For speaking order in the process for speaking, I'll provide each member with the opportunity to ask questions or comment. Members will be called upon to speak in the order or reverse order as set out in the board secretary's voting list. The usual 5-minute limit will apply. Should you not wish to speak on a given matter, you may decline verbally when your name is called. On voting, if a full recorded vote is not taken for a given item, I will specifically ask if the item is carried and then call for dissents to ensure that all votes are properly registered. Any points of order, privilege, or challenge, procedural interjection should be kept to a minimum to ensure the meeting proceeds smoothly and to minimize confusion. For points of order where you have not been called upon to speak, please state your name aloud for the record before stating your point of order. Recess, should we have technical difficulties, and fingers crossed that we don't, but we're all operating from our homes tonight, so anything could happen, or other unforeseen matters require recess during the course of the meeting, unless the board secretary issues new instructions, members are requested to remain on the line, so to speak, and the board secretary will mute all participants in such an instance. Are there any declarations of pecuniary interest? Okay. Seeing none, thank you. Can we confirm the minutes of the meeting of February the 8th, 2021?
Okay.
Carried, thank you. We have received 14 communication items that have been received and are held on file with the Board of Health Secretary. Can we receive these communications as noted in the agenda, please?
Received.
Received.
Thank you. I'm going to ask Member Gower, who will be moving our procedural motions tonight, to introduce, bring the motion to introduce reports, please.
Okay, thank you, Chair. Let's bring it up on my screen here. Motion to introduce reports. Be it resolved that I've lost it again. Be it resolved that the Chair of the Board of Health verbal report, the Medical Officer of Health verbal report, and the reports titled Ottawa Public Health 2020 Annual Report, Ottawa Public Health Emergency Preparedness and Response 2019-2020, 2020 Budget Year-End Results, Board of Health for the City of Ottawa Health Unit Status Report, Delegation of Authority, contracts awarded for the period of July 1 to December 31st, 2020, and participation in the Association of Local Public Health Agencies 2021 Annual General Meeting and Conference be received and considered.
Carried.
Carried.
Thank you. We'll now go through the consent agenda process. For those participating or watching from home who may not be familiar with this process, I will list each item on the agenda, and for any items where board members don't have any questions or concerns, and we don't have any public delegations registered to speak, the board may carry or receive those items on consent, which is to say, without any discussion. So first is my verbal report, and so we'll hold that as I'll be presenting. Second is Dr. Etch's verbal report, so we'll hold that. And we also have some delegations in that regard. Next is Ottawa Public Health 2020 Annual Report. We also have a delegation for that, so we'll be holding that. Ottawa Public Health Emergency Preparedness and Response 2019-2020. Can we carry that matter?
Received.
Steve, thank you. 2020 budget year-end results, Board of Health for the City of Ottawa Health Unit status report. Can we receive or carry that one as well?
Received.
Thank you very much. Next is our delegation of authority contracts awarded for the period of July the 1st to December the 31st, 2020. Carried?
Received.
Or received rather, sorry, thank you, Member Santé. And finally, participation in the Association of Local Public Health Agencies, or otherwise known as ALPHA 2021 Annual General Meeting and Conference. Carried?
Okay.
Thank you. I will give my verbal report now. As I indicated, we have a number of public delegations, most of which would like to speak, I believe, to the issue of vaccine prioritization. This was a little bit of a challenge because it's not formally an agenda item, and the normal rules would be that a delegation is attached to an agenda item. I met over the weekend with both Dr. Etches and the Secretary of the Board as to how we could accommodate these delegations. These are difficult times, these are confusing times, so we want to give every opportunity we can to hear from the public, if possible. So the decision was made that the delegations could come in under the umbrella, if you will, of Dr. Etch's verbal report, as she will be touching on vaccine in some respect in her verbal report. So those delegations then we'll deal with, or we'll hear from rather, after Dr. Etch's report, and that allows us to stay within the rules of the board and at the same time to accommodate the public, which has come out tonight and wants to speak to us and share their viewpoint on an important issue. So I want to thank our board secretary for working with me through the procedures to be able to do this tonight. Much appreciated. So good evening, everyone. Bonsoir, Quay. For my verbal report tonight, I would like to provide board colleagues with updates on some recent events. Firstly off was the stigma training that was provided last month by Ottawa Public Health's Mental Health and Substance Use Unit. And it offered training to members of council and their staff titled Stigma, the Power of Language in Supporting Your Community. 2 virtual sessions were held on March the 16th and the 24th. These sessions were led by public health nurses Linda Cove and Caroline Balla. Between the 2 sessions, 11 members of council participated, as did 44 councillors' assistants. This 30-minute training provided members of council and their staff with information, resources, and tips on communicating with residents about the pandemic, mental health, and substance use. The goal was to equip participants with knowledge and tools to communicate with residents about COVID-19, mental health, and substance use in a way that can help residents feel supported and informed without perpetuating further harm. Essentially, the training helped explain what stigma is and how it might prevent people from seeking proper care. It also provided tips and suggestions on how to use language that prevents stigma, including concrete examples that we can all use in our daily interactions. I'm told that OPH is working with the Community Addictions Peer Support Association, CAPSA, to explore the development and delivery of in-depth substance use anti-stigma educational sessions to our community. Those who participated in the training in March received several handouts and aids to support them in applying what they learned into everyday exchanges with residents. Following these sessions, attendees were also given the opportunity to register for a 90-minute virtual suicide prevention training, which they could take at their own convenience. Following the sessions, participants were invited to complete an evaluation survey, and I'm happy to report the feedback has been largely positive. I personally would like to thank Linda and Caroline and for providing this training opportunity to counselors and their staff at this important time, as well as Erin McClellan and Chanel Brown, who helped coordinate the sessions. It was very well and professionally presented. It was very informative, and as I said, very timely at a very difficult time in our community. So much thanks. Next, I'd like to speak to the interfaith ceremony that occurred on March 25th. Some of you may be aware that on the 25th, the mayor hosted an interfaith ceremony to honor all City of Ottawa residents who have lost their lives to COVID-19. Dr. Etches participated in that ceremony, as did Algonquins of Pikwanigan First Nation Chief Wendy Jocko, Mr. Francois Couillard of the Baha'i community of Ottawa, Reverend Dr. Anthony Bailey from Parkdale United Church, Rabbi Aydin Shir of the congregation Mashishke Hadas, and Imam Samuel Matwali from the Islamic Society of Gloucester. The ceremony was held in front of City Hall next to the 2017 Cauldron and featured musical performances by local musicians, cellist Julian Armour and harpist Caroline Leonardelli. Some of you may have watched the live stream or had an opportunity to view the video after the fact. It was a touching and fitting ceremony. If you haven't seen it yet, I encourage you to watch the video. It is available on Mayor Watson's Facebook page. As Dr. Etches noted in her remarks on that day, March 25th, 2020 was a sad day for all of us. It was the day we shared the news of Ottawa's first COVID-related death. Since then, 482 Ottawa residents have lost their lives to this illness. Each one of them was loved, they continue to be missed, and will forever be remembered by their loved ones. Though I was not able to participate in person on the 25th, I would like to add my condolences and prayers to Ottawa residents who have lost loved ones to COVID-19. And I was wondering, with everybody's indulgence, if we could just have a moment of silence to remember the people who have passed due to COVID. Thank you for that. As we all know, we have now entered into a new phase of this pandemic, one that gives us hope, and that is the massive undertaking of getting people vaccinated. I'm happy to say that on April the 16th, I was able to get my first shot of a COVID-19 vaccine. After the province announced that those 55 plus were eligible to book their appointments at pharmacies to receive the AstraZeneca vaccine, I took the opportunity to book my appointment. I reached out to my local pharmacy and took the first appointment I was offered. It was fast, easy, and I was lucky to only have mild side effects of a sore arm. And it reminds me of the advice Dr. Etches provides on a regular basis, and that is when your opportunity becomes available, you should take it up at the earliest possible opportunity. And Dr. Etches will be speaking later this evening about the various avenues and channels that are available now for residents of Ottawa to access vaccinations. We're hearing reports of people having concerns about the AstraZeneca vaccine. Everybody should know and understand that Canada's leading medical and scientific experts have determined that the risk of a serious outcome for being infected with COVID-19 is far greater than the risk of a serious side effect from the AstraZeneca COVID-19 vaccine. Health Canada continues to reassure Canadians that the AstraZeneca vaccine is safe and effective. As we so often hear from doctors and other medical professionals, the best COVID-19 vaccine is the one you can get. I encourage everyone to take advantage of the first opportunity available to them to get vaccinated. So please, if you are eligible for vaccine, book your appointment today. In closing, while we recognize that vaccines are a vital part of the COVID-19 response, we also know that it will take months until enough of the population is vaccinated for it to be safe to relax public health measures. Meanwhile, we are also keenly aware that Ottawa is experiencing its biggest resurgence of COVID-19 cases to date. The fact is, we cannot vaccinate our way out of this third wave, so it is vitally important that each and every one of us continue to do what we know works to stop the spread of COVID-19 in our community. And that means going back to the basics. Stay home, except for essential trips. Limit contacts to those who are in your own household. Practice physical distancing and wear a mask. Wash your hands regularly and don't touch your face except with freshly cleaned hands. And stay home if you're not feeling well, or if you've been exposed to someone who has tested positive for COVID-19. We also know that this pandemic has been long and hard. Please remember to be kind to yourself and to others. Take time for some self-care and rest. Check in on your own mental health and check in virtually on relatives, friends, neighbors, and colleagues. That concludes my verbal update. I'd be happy to take questions.
Good question.
Yes, Member El-Chantry?
Thank you. First of all, thank you for your verbal report, and I'd like to echo my thanks to the staff who provide us the training on stigma, to myself and my staff. But I was surprised to hear only 11 council participate. There is a possibility you can reach out to the clerk, and because some of the training, it was mandatory for us council to take early this year, and I was wondering why this one was not in that category of mandatory to be given to council.
Yeah, no, that's a very good question. I don't know if Dr. Etches can speak to that, but I think that we can probably arrange for another round of this training, because I agree with you, Member El-Chantry. It was excellent, and as I said, very timely in terms of what we're dealing with, both within our communities, our families, our residents. Dr. Etches, would it be possible for us to offer another round of this training?
You know, I'm sure the team would be very happy to provide another option for those who maybe the timing didn't work. And with your feedback that it was so valuable, I think we should be able to bring people out.
So what we'll do, Member El-Chantry, is I'll have the board secretary reach out, make those arrangements, and then share the availability with the board and also with all council.
I would really appreciate that, Mr. Chair. Thank you. And perhaps maybe a discussion between you and Mr. O'Connor can really push a little bit to it. It is a valuable. I mean, you don't need to sell it. It is really once you spend time listening, you'll know how valuable it is. Anyway, thank you very much.
I'm happy to have that chat with the clerk as well. That's a good suggestion. I don't mind doing that at all. Are there any other questions? Can we then receive the verbal report?
Receive.
Thank you. Receive. Now going to call on Dr. Etches to present her verbal report.
Well, good evening, Kwei, Enge, Tanji, and bonsoir. I will provide updates tonight on the Ottawa health teams, also the COVID situation in Ottawa, and we're going to speak a bit more tonight about how our neighborhood-based approach continues. And I'm going to speak about the local COVID-19 vaccine rollout, which, of course, my colleague, Mr. DeMonte, is also well positioned, in some ways better positioned to speak to. So he is going to be available to answer questions of the board after the public delegations. And so as we've shared previously, the Ontario Health Teams, OHTs, were introduced in April of 2019. Hard to think back before the pandemic, but it was a new way to organize and deliver care. And we have been an active member of every OHT in our area. And really, actually, COVID has accelerated the opportunities for us to work collaboratively across the health system. And it's enabled us to start to use these OHTs to address populations facing greater health inequities. À bien des égards, la COVID-19 a accéléré les possibilités de travailler en collaboration dans l'ensemble du système de santé. ce qui a mené à de nouvelles approches pour aborder la santé de notre population et réduire les inégalités en matière de santé. And so in addition to the neighborhood level efforts that are supporting the COVID response and the vaccine rollout, the Ontario health teams do continue their work in other areas. Now, one of the OHTs that we haven't spoken about yet to date much is the Four Rivers OHT. It captures the western parts of Ottawa and it extends into neighboring health units to the west and the southwest of our city. This Four Rivers OHT was invited by the ministry to submit a full application. And so we'll be receiving this document shortly. We'll look to sign off as a partner probably by the end of April, and we'll keep you informed as the status evolves. I also wanted to share that the efforts to improve access to mental health and addiction services have been making gains through this, the Ottawa-based OHT. So the Ottawa Health Teams Counseling Connect initiative has brought together several community-based providers under a single booking platform, and that's enabled same-day or next-day counseling appointments. And thousands of appointments have been booked since it was launched last May. Further, the One Call, One Click initiative is led by the Kids Come First health team, and that will improve access to youth mental health care across the region. And this is expected to launch as a first phase in the coming weeks. So as the effects of the pandemic wear on, ensuring timely and equitable access to supports for mental health and substance use challenges, it continues to be an important priority and part of our collective response. So we're very thankful for the OHT's work with us in these areas. So moving on to the current COVID-19 situation in Ottawa, I know Dr. Brent Malachny provided a very detailed presentation at last Wednesday's technical briefing, and then he and Mr. DeMonte answered a wide range of questions from members of council and the Board of Health. Very thankful for the chance I had to recover my voice and for the good leadership of Dr. Malachny. Tonight, I'm going to focus on what we've seen recently with respect to the data and the trends, and provide an update on some of our targeted efforts to reach specific communities. Moi, je vais me concentrer sur ce que nous avons vu récemment en ce qui concerne les données et les tendances et faire le point sur certains de nos efforts ciblés pour atteindre des communautés spécifiques. So over the past week, just going to pause, you know, we have continued to see a high number of Ottawa residents testing positive for COVID-19 each day. And since Wednesday's technical briefing, the daily average has been 288 infections reported to us. And the percent of people testing positive is still very high at over 10%. Hospitalizations have continued to rise significantly. And the median age of COVID patients now currently in Ottawa hospitals is 66. So we don't see that trend turning. The majority of people are still testing positive due to transmission within a household and due to social interactions where people are in close contact without mask use. So indoor environments provide and pose the greatest risk for COVID transmission. But people are still coming into close contact with people outside of their households in parks and on trails, for example, and this risk also requires more attention to keeping distance when outdoors and to wearing a mask when that distance cannot be assured. We are dealing with the variants of concern and a more transmissible virus. So while healthcare and school and childcare settings account for most outbreaks currently reported in Ottawa on our dashboard, COVID transmission continues to lead to outbreaks in a wide variety of workplaces where people cannot work from home. They're in restaurants, in retail, in services and construction, lots of different settings. And I want to provide some context from what I'm hearing from the team. We see there's 3,412 people we know about in Ottawa with active COVID-19 infection. There are 3 childcare workers who are currently positive related to 3 outbreaks. where the number of children positive is also 3. And workplaces, they're currently required to report to Ottawa when more than 2 of their workers in one work site have tested positive. And our team is now being inundated with calls from workplaces where more than 2 people have tested positive. We're also seeing outbreaks in offices where people could have potentially worked from home. So employers are required to ensure that employees who can work from home do work from home. We need a significant reduction in the interactions between people. It's still critical to turn this resurgence around, and employees that can work from home must work from home. Many workplaces have been working very hard to maintain COVID protocols and requirements. However, recent inspections efforts of a cross-section of over 80 businesses have highlighted deficiencies in half of those businesses. It was mostly related to the lack of screening for symptoms in workers or the lack of a COVID-19 safety plan. Further, in a small minority of, some businesses have received repeated infractions, and they're making entry and inspection difficult for enforcement officers to verify compliance with provincial and local requirements. So, as has been previously reported, there are a number of neighborhoods and communities in Ottawa that have been disproportionately impacted by COVID-19. And our neighborhood-based efforts to increase support for access to COVID testing and self-isolation, food if people need it, emergency services, it continues. And for the past several months, Ottawa Public Health's been working with community partners to advance engagement activities with a focus on building vaccine confidence, along with the work to promote the COVID-wise practices. And so Ottawa Public Health's Community Operations Branch and the Community Engagement Task Force under the vaccine program, they've partnered with community organizations to host public town halls in multiple languages, featuring the voices and the perspectives of health professionals from diverse ethnocultural backgrounds. And these town halls have been held in Spanish, Arabic, Somali, English, and French. They've enabled a dialogue where Ottawa Public Health and partners have listened and addressed concerns from residents while highlighting credible sources of information to assist in building vaccine confidence. And feedback from these sessions, it continues to influence our planning and our operations and our engagement work. It's led us to shift more staff to ensure that staff who have diverse language abilities are working at specific pop-ups to support residents in their first language. We've been allocating additional accessible parking spaces around vaccine sites, and we're adapting processes to better support individuals living with disabilities. We continue to learn about ways to share information with diverse audiences. Ottawa Public Health's been working with community partners and service providers using a train the trainer model to help build capacity to discuss vaccines with residents and help build, again, vaccine confidence, and also support people to access vaccines, to know what the various points of access are and to use them. And so this work, again, is supported by frequently asked questions, tips on talking about vaccines, vaccine presentations. Ottawa Public Health also partnered with the Ottawa Disability Coalition and the City of Ottawa's Accessibility Office to host a COVID forum for people with disabilities. And we've recently published Resources in American Sign Language, a web page that provides accurate, reliable, up-to-date information on COVID-19 to Ottawa's deaf and hard of hearing community. So the web page has instructional information in video format in American Sign Language. The team overseeing the logistics of the vaccine rollout is also continuously working to diversify and evolve distribution models to reduce barriers for populations that have been disproportionately impacted by COVID-19 or who face systematic barriers to accessing health services. So we're currently working with community health centers, other partners, primary care providers, residential buildings, private Ottawa community housing buildings. We're launching barrier-free vaccination clinics in neighborhoods, and more specifically in residential buildings and high-risk congregate settings as well. Nous travaillons activement avec les centres de santé communautaires et d'autres partenaires, y compris les fournisseurs de logements privés et logements communautaires d'Ottawa, pour lancer des cliniques de vaccination pop-up sans obstacle dans ces quartiers, et plus particulièrement dans les immeubles résidentiels et les lieux de rassemblement à risque élevé. So more next on the vaccine rollout. And as most of you would be aware, of course, we're working with the city's Emergency Operations Center on planning and coordinating the vaccine program. So at this time, there are multiple channels for eligible Ottawa residents to access the vaccine. And I appreciate this in some ways makes it harder because there's different opportunities, there's sometimes more choice, or there's, people then have more information to digest when they're trying to sort out, when do I go somewhere, is it my turn? But they do include Ottawa Public Health community clinics, pharmacies, primary care settings, pop-up clinics in hotspots, and high priority neighborhoods. À l'heure actuelle, les résidents d'Ottawa admissibles peuvent accéder aux vaccins de diverses façons, notamment par l'entremise dans des cliniques communautaires de santé publique Ottawa, des pharmacies et des établissements de soins primaires, ainsi que des cliniques spontanées dans les points chauds et les quartiers prioritaires. So we also have mobile teams that are bringing vaccine to homebound residents, and there are people living and working in congregate care settings. And our hospital partners are operating clinics for healthcare workers, some essential caregivers in congregate care settings, faith leaders, special education teachers, and individuals with the highest risk health conditions and a caregiver of theirs. So to date, a total of, got a specific number here, exactly 277,939 doses of COVID-19 vaccines were administered in Ottawa. And this includes over 20,000 we know of that have been administered in pharmacies. 89% of this inventory distributed to Ottawa Public Health, the Ottawa Hospital, and Queens Bay Carleton Hospital has been administered, and the rest, we have approximately 51,650 appointments are now booked to use that vaccine, and what will come through to April 30th. All of our large community clinics are fully booked with people over 60 until that date, April 30th. Much more data about the vaccination program is available publicly on our website at ottawapublichealth.ca/vaccine dashboard, and it's updated Mondays, Wednesdays, and Fridays. So Ottawa Public Health and the City of Ottawa are following the provincial ethical framework and the 3-phased vaccination distribution plan that's guiding local COVID-19 vaccine rollout. We are required to follow the provincial framework, and it's an ethical framework that's included based on principles of stewardship and trust and equity, transparency. So it's based on evaluation of population risk of exposure and the risk of severe disease or outcomes, and also health capacity required to ensure the ongoing care for the population. No surprise, you've heard it from many places, but there is a limited number of vaccines available, and therefore our vaccine distribution framework, it helps guide decisions in this context of limited vaccine to ensure equitable distribution. And it does support the goal of Ottawa to reduce the risk for people more severely impacted by COVID-19 in Ottawa. Le nombre de vaccins disponibles est limité et par conséquent, le cadre de distribution des vaccins aide à orienter les décisions pour assurer une distribution équitable. Il soutient également l'objectif de réduire les risques pour les personnes plus sévèrement touchées par le COVID-19 à Ottawa. And so Significant progress has been made in vaccinating the phase 1 populations, but not all individuals who are eligible to be vaccinated in phase 1 have received their first dose. And then moving into the age categories in phase 2, at this point, 60% of people in their 60s remain to be vaccinated. And 75% of people in their 50s have not yet been immunized. So these age-based populations are a priority because over 80% of hospitalizations and ICU admissions are of people over 50. And the rate of death, if we compare rates by saying the rate of death per 100,000 population, for people in their 60s compared to people under 40, it's over 230 times the risk of death for people in their 60s compared to people under 40. And for people in their 50s, their rate of death is over 40 times that of people under 40. So at this time, we need to continue to focus on preventing every possible hospitalization. Our hospitals are already pressed to provide intensive care for current and projected COVID-19 patients. They have canceled all non-elective procedures, ambulatory care. They're redirecting their staff to care for COVID patients. And as we continue, the vaccination of some phase 1 populations is ongoing. It was April 6th that the government of Ontario announced it was moving to phase 2 of the COVID vaccination plan. It is placing initial priority on older adults, individuals living in hotspot communities where COVID-19 has impacted neighborhoods with the highest risk health and their caregivers, and people who live and work in the. So we are continuing to ramp up our vaccination efforts as the vaccine supply comes in. And the large community clinics, I think I mentioned, they're booked until April 30th. They're booked with people over 60, and that will allow us, we are estimating, to actually reach our target of 75% or more of people over age 60 being immunized by that date. And so this is creating a time when we can pivot in our strategy to start to offer more vaccine to workers who cannot work from home as we move into May. The supply of vaccine expected to be received from the federal government, however, is a little bit lower for us, so potentially over the first couple of weeks of May. And then we're again expecting a significantly greater distribution of vaccine from the federal government through the province further into May and into June. So right now, we're in a period of planning for this pivot from using our large community-based vaccination clinics for older adults to be able to use them for the other phase 2 priority populations, including workers who cannot work from home. Another sip of water. So the Ottawa approach is to continue to focus on neighborhoods with less advantage and higher rates of COVID-19, where there are many people who cannot work from home, where people live, where regardless of where they work, what workplaces. Partly because the larger clinics require a booking system and they require more transportation. And we know that the neighborhood-based approaches are more barrier-free, including growing the walk-in and walk-up options. So as the vaccine supply grows, I think you can expect to see the neighborhood level initiatives will also continue to grow. So I know you know this, that I want to say we're very grateful at Ottawa Public Health for the critical work that people are doing who are not able to work from home. And we have been encouraging essential workers to access vaccine as soon as it becomes available to them, whether it's by their age, by their neighborhood, by virtue of their job, or because they're a caregiver to a loved one in long-term care or living with a highest risk health condition. Further, I will be providing direction to primary care providers to use the opportunity of now, it looks like, we're still getting more information, but the province is going to allow AstraZeneca to be used for people in their 40s, to use this as a priority for people who cannot work from home. And that will create another channel of vaccine access, as long as this fits within the provincial direction about this change in age eligibility. As the chair has noted, we cannot vaccinate our way out of this third wave. And that isn't just because we don't have enough vaccine. It's because we are facing exponential growth of COVID transmission. And the only way to shut that down as quickly as it needs to be turned is to decrease the opportunities for us to come into close contact with others. We're going to continue to vaccinate residents as quickly and effectively as we can, based on the provincial framework and the vaccine supply. We're building up herd immunity. We'll get there. That will protect us against future resurgences of COVID-19. Comme l'a noté le président, nous ne pouvons pas nous sortir de cette troisième vague ou cette augmentation dans le nombre de cas par la vaccination. Nous continuerons à vacciner les résidents aussi rapidement et efficacement que possible en fonction du cadre provincial et de l'approvisionnement de vaccins, afin de renforcer l'immunité collective pour prévenir les futures résurgences du COVID-19. So in the interim, prevention is key. We need to keep doing the things that we know work to prevent transmission. And adherence to provincial public health measures, or public health measures in general, it continues to be achieved largely with a focus on encouragement, on sharing information, on raising awareness of what is required and why it's required. And so this weekend, representatives of the Ottawa Public Health, the City of Ottawa Bylaw and Regulatory Services, and the Ottawa Police Service met to discuss any new measures and how they might be administered for a positive public health impact. When new enforcement measures are considered, we need to take a deliberate and careful approach that emphasizes equity, legality, advocacy, and the application of these authorities with a specific and exclusive purpose to support public health measures. So what we're currently seeing in terms of situations in the community that pose a risk for the transmission of COVID is there are situations where there are effective enforcement measures that already exist. And egregious violations of public health orders are covered by enforcing existing measures. Therefore, a coordinated enforcement approach to situations that are creating public health risk will continue to use the existing tools. And at this time, the current public health risk assessment is that different enforcement or action by police authorities could create some challenges with compliance to public health orders, and it could set back COVID-19 control measures if not careful. And so current medical literature or professional studies that have been done reinforce the opinion that especially homeless populations and other disadvantaged communities in particular require support to be able to increase protection from COVID. Support rather than enforcement. So we will continue to work closely with our many communities and public partners to ensure that community members across Ottawa remain safe, respected, and are informed and supported to decrease COVID transmission in the community. And we do recognize, again, not everyone can work from home. Workers who cannot work from home don't have that choice. And so at this time, we are looking for your support to what I recommended to the province through a letter with the Medical Officers of Health in Toronto and Peel previously, to take a critical look at the provincial government's approach to essential businesses, to really take a look at limiting the number of people who are at risk for COVID transmission in the workplace by focusing on having businesses that provide essential services like food, medicine, services required for health and safety, or medically necessary care as the ones that continue to be open. And I'm going to turn as my last subject to the subject of a Section 22 order, which I know during last week's technical briefing, there was a mention of a Section 22 order to mandate mask use and set capacity limits on or near outdoor recreational amenities. That was put on hold Friday after the provincial announcements and has been reevaluated, given further changes to the provincial regulations on the weekend. We do know that outdoors is safer than the indoors in terms of the risk of COVID-19 transmission. And we continue to encourage people to get outside for fresh air, to play, to do physical activity. And as mentioned earlier in this update, it is important even outdoors that people maintain physical distancing from people outside of their household, and that people wear masks in situations where physical distancing may be difficult. Il est important, même à l'extérieur, de maintenir une distance physique avec les personnes extérieures à son foyer et de porter un masque dans les situations où la distance physique peut être difficile. So given that the province is now allowing playgrounds to be open, I will be issuing a Section 22 order to ensure appropriate mask use and physical distancing when using and near the playgrounds. This is not dissimilar to what happens in school environments where school-aged children are required to wear masks when they are playing outside during their recess. Further provincial restrictions are necessary to limit COVID-19 transmission in Ottawa and across Ontario. And so I do welcome the Board of Health support in calling on the Premier to enact stronger measures to limit workplace transmission. And I want to be very clear that unless we as individuals do all we can to limit close contacts we have with others, we won't be successful in turning this curve and preventing deaths as we are vaccinating to build up the protection we need against future resurgences. So thank you for your support. This does conclude my verbal report, and I'd be happy to take any questions after I think we hear from our delegation.
Thank you, Dr. Etches, and we'll get to the delegations in just a short moment, but following up on some of the things that you suggested in your report, I'm going to ask the Vice Chair to introduce a motion on my behalf so that the delegations and the board members are aware of it as we progress in the meeting. So Vice Chair, if you could do that, please. And perhaps, Deanne, can we get that on the screen for people at home? Thank you.
Whereas the goals of the pandemic response are to limit hospitalizations and death and to minimize societal disruption. And whereas the closure of schools is intended to reinforce the importance of families adhering to the stay-at-home order to control the growth of variants of concern and to flatten the curve, though we recognize that schools are essential for the well-being and healthy development of children and youth, and whereas rapid growth in the number of people testing positive for COVID-19, hospitalizations, and ICU admissions continue to the point where the health system is challenged to keep up, and whereas COVID-19 transmission continues to occur in a wide variety of workplaces that provide products other than food, medicine, and services essential to health and safety, and whereas public health experts agree that in order to curb current rates of transmission and lessen the burden on our healthcare sector, all non-essential businesses and workplaces should be closed or limited to virtual or remote operations. Whereas enhanced inspection powers would facilitate enforcement of the regulations at places of business, whereas additional restrictions at a level beyond the current provincial measures have been necessary to control the growth of variants of concern now predominant in Ontario, including the closure of non-essential retail settings. Therefore, be it resolved that the Board of Health for the City of Ottawa Health Unit direct its chair to write to the Premier of Ontario to request the following: that the Premier of Ontario urgently complete a review of all businesses and services that continue to have workers at the workplace who cannot work from home, and implement changes to ensure that only businesses that provide groceries, medications, and products or services essential for health and safety are open, and only medically necessary care is provided for the period of the stay-at-home order, and that workers affected are provided with information on income support options. That the school closure language in Ontario Regulation 8220 be amended to replace shall not provide in-person teaching or instruction with schools shall be closed to all students except for, in order to provide greater clarity and ensure continued remote learning, and that students are not attending school in person for activities that do not qualify as in-person teaching or instruction. And that improvements be made to the enforcement provisions under the Reopening Ontario, a Flexible Response to COVID-19 Act 2020, and the Emergency Management and Civil Protections Act to enhance enforcement officers' ability to enter, investigate, and close businesses.
Thank you very much, Vice Chair, for introducing that on my behalf. And we will vote on that, take any questions that might arise out of that after we hear from delegations. Our first delegate is Donna Mortimer. And Donna, you have 5 minutes to make your presentation. Thank you.
Thank you. I would like to thank the Standing Committee for hearing this important and impactful issue pertaining to childcare. My name is Donna Mortimer. I'm Vice President of Local 2204, and I'm speaking to you today to express the importance of vaccinating the childcare workers of Ottawa. Childcare workers have been deemed essential. Childcare centers and home daycare remain open in the face of this COVID-19 pandemic. The third lockdown in Ottawa has just begun. Schools have closed to keep the community safe. However, childcare workers spend our days with unmasked children in centers and provide quality care to our youngest citizens. We are still questioning when Ottawa Public Health will give all childcare workers priority access to vaccines. As Vice President of our local, I hear of the members' fears, anxieties, and of their overwork. Many concerns have been how to handle the pandemic. I am concerned about the members of 2204. Their mental health is suffering and burnout is increasingly common. My center has 14 employees. In this calendar year, 2 members have gone off on stress leave and 2 have retired early because of the stress. Through working with employers and following COVID-19 protocols, childcare workers have worked through the brunt of this pandemic while waiting for the vaccine to ease their discomfort. By not prioritizing childcare workers today, the Ottawa government is refusing to acknowledge the worth of a sector that they have deemed essential. If other municipalities like Niagara Region can put childcare workers to the front of vaccination lines, I believe that Ottawa can do the same. With respect, I ask for a date to be set for all childcare workers to receive a vaccine. It is time for the childcare sector to get the recognition it has earned. I encourage the board members to review the written submissions made by some QP 2204 members who could not attend this meeting. The members of QP 2204 are looking forward to hearing a public response from the Board of Health on this very significant issue. And I understand there are many communities that need it just as desperately. And we're just one of the many. But thank you for listening to me today.
Thank you very much for coming out today. Appreciate your participation. Are there any questions? Member Menard.
Thanks very much, Chair. Thanks for being here, Ms. Mortimer. I'm just wondering if you had a chance to review the statement that was put out by Mr. DeMonte and Dr. Etches today with regard to vaccination rollout and some of the implications provincially and locally.
I have not had a chance to do that, but thank you for pointing that out to me.
I think it would be helpful. It just came out today, and I suspect a lot of delegations probably haven't seen it. And so I know it was shared with the board before our meeting and then earlier on today. I wonder, Dr. Etches, if there's a way we can publicize it through news release or something else like that as well. I don't know if there's a possibility, but just to get the word out there for folks that haven't seen it yet, because I think probably you're in the same boat as others, I'm sure.
Thank you very much. Sorry, Dr. Etches.
Oh, through you, Mr. Chair, we could certainly circulate that to the people who are delegating. We have their contact information and look at sharing it in other ways. I think my verbal update also hopefully provided a bit of information about timelines and how quickly we will be moving along in phase 2 populations.
Thank you, Dr.
Thank
Etches. I don't see any more questions for this delegate, so thank you again. Our second delegate of the evening is Cynthia Haddon. Good evening, Cynthia. If you're out there.
Everyone, can
Oh,
you
there
hear
you
me?
are. Yeah, we can hear you, and you have 5 minutes. Thank you.
Thank you. I would like to thank the Board of Health for this opportunity to speak today. I understand that vaccination prioritization wasn't a point that was necessarily meant to be discussed this evening, but as the chair of the board has mentioned, people are absolutely feeling a sense of urgency at this time. So I am grateful to be speaking here today. My name is Cynthia Haddon, and I am the mother of a 4- and 7-year-old, a resident of River Ward, and a childcare worker currently not working due to the high cost of my own childcare fees. I am here today to address the fact that childcare workers in Ottawa have not yet been able to access the COVID-19 vaccine. This lack of health and safety in childcare affects many people in this city. For parents, childcare is currently a cause of grave concern. They are afraid to send their children to care, but also know they cannot manage the care of their young ones while also working. Parents are constantly worried about the announcement of the closure of their childcare program. Managing work and guiding older children through online learning is challenging enough. Having their infant, toddler, or preschooler at home as well means something will have to give. Having vaccinated adults working in these programs will drastically reduce the impact of COVID in childcare. The program that I will be returning to is currently closed due to the COVID positive case of one of my coworkers. If she had had her vaccination already, she would still be working, my other coworkers would still be working, and the 16 families in the program would still have care. When one person in childcare is affected by COVID, many more will also suffer. I've heard the concern from friends who are parents, and I've also heard what is being said in the childcare community. Resoundingly, these workers are feeling forgotten. They feel unseen and they feel desperate. The reality is that many workers in this sector are disproportionately affected by this pandemic. Many of my coworkers are minorities, almost all are women, and they often live and work in neighborhoods with higher rates of COVID. At this point, many are completely burnt out. They are constantly fighting to stay above water, and they are working with limited resources to keep their doors open. And frankly, they have no energy to advocate for themselves. Being here today and appealing to you is the least I can do for my community. I struggle to understand why other regions have prioritized the vaccination of their childcare workers, and yet Ottawa has not. It once again saddens me to see how undervalued childcare is in our society. Dr. Etches, you have been a true hero during this pandemic. I hear it time and time again from friends and families how you understand the plight of young families, how you see the value of a system that supports parents. I urge the board and yourself to please consider prioritizing the vaccination of childcare workers. Please follow the lead of other Ontario regions and make childcare a priority. Thank you.
Thank you for your delegation. I don't see any hands up, so thank you. And I will call on our next delegation, which is Michelle René de Courtrai. And you have 5 minutes, please.
Sorry. My message is very similar to the two previous ones and deals with the need for early registration, if not vaccination, for people in the Ottawa early learning and childcare sector. My purpose today is to ask Ottawa Public Health to exercise its discretionary authority to prioritize those working in the licensed childcare group and home for access to the vaccine now that we are in phase 2 of the rollout. I wish to thank first the City of Ottawa Children's Services team, Ottawa Public Health, city councillors, and others for their leadership and guidance throughout this past year. It has certainly been a journey full of ups and downs, and the words "we're all in this together" have never had more meaning. But as we all know, we are not nearly done. We understand that managing the logistics of the vaccination phases is an enormous task, exacerbated by an unknown predictability of supply and additional provincial requests to focus on specific populations. But as the previous speaker said, Ottawa Public Health has an opportunity, as has been done by other public health units in the province, to give as much value to the early learning and childcare sector as has already been given to teachers and other employees of school boards working at schools. Every day across Ottawa, thousands of children are being greeted by those working in licensed group and home settings so that their parents can work. Most of these children cannot wear masks and are too young to do so. Educators are cuddling, comforting, and carrying them. The educators cannot and should not be maintaining a 2-meter distance, and their work cannot be accomplished virtually. Young children have continued growing and learning during the past year, and their educators are helping them thrive. When the pandemic protocols were identified 1 year ago, we collectively announced, we've got this. The licensed childcare sector already understood the importance of infection control practices. And our success can be seen. The transmission of the virus in licensed childcare settings is comparatively quite low. We are proud of this, but this does not make it less hard. The daily risk of contracting or spreading the virus weighs heavily on our educators in group settings and on childcare service providers. And it is accumulative, especially now as we enter and start dealing with the demands of this third wave and third round of offering emergency care. We understand that vaccine availability is limited, but we believe that there are immediate steps that could be taken by Ottawa Public Health, starting with stating that those who are working in licensed childcare are a priority, and then initiating the registration and sign-up process so that when vaccines are available, their distribution may be as efficient as possible. Remembering, of course, that those working in licensed childcare will need evening and weekend appointments. Thank you. That was my message.
Thank you very much. Appreciate that. I don't see any hands up, so we'll move to our next delegation, which is Velvet Leclerc. And Velvet, you have 5 minutes, please. Thank you.
Thank you. So my name is Velvet Leclerc, and I'm here to speak to you about the second phase of COVID vaccinations regarding childcare workers as well. Many of my colleagues are also speaking today, asking you to prioritize workers who work in childcare centers. I agree with them. Daycare teachers need to receive the vaccination promptly, as they are caring for large groups of young children who are unable to wear masks and do not have the spatial awareness to understand the concept of social distancing. We were very pleased that the provincial government included our sector in phase 2, but it was demoralizing to see that we're at the bottom of the list and it is still not clear what kind of childcare workers are eligible. I've been working as an early childhood educator for the past 20 years. Currently, I run a home daycare, but I've worked in center-based care for 12 years before that. I took home daycare business training through the Childcare Providers Resource Network, and I opened my home daycare independently without being affiliated with a licensing agency. As a single mother living in Centertown with a high cost of living, being a licensed home daycare provider was not an option for me because it's not financially viable. Unfortunately, there's a huge stigma when you run an independent home daycare, which is not really acknowledged by the municipal government. Even though I follow the same regulations, pay taxes, have a business license, and operate a high quality program, because of my experience, it is hard to be recognized as a professional childcare worker. An example of this has been made painfully clear during this pandemic. I have heard of COVID outbreaks in independent home daycare settings, but we are not classified as institutional outbreaks by Ottawa Public Health. Instead, only licensed home daycare providers are classified as institutional outbreaks. Outbreaks in my sector are classified as community contact. I find this very misleading to the public, and I have contacted Ottawa Public Health to discuss this threat to public safety, but I'm still waiting for a response. So with that being said, it's safe for me to assume that I am not going to be eligible for the vaccine because of my business model and the type of childcare that I provide. This worries me because if home daycare providers are not eligible, then neither are nannies. Home daycare and nanny share arrangements have become a more popular alternative to center-based care because of COVID, and because of the lower ratios and less exposure to large groups. There are many ways for municipalities to interpret the term childcare worker. There are loopholes in how it is worded. I am working from home, which makes me ineligible for the vaccine, but I am not working virtually and I care for 5 children, which should make me eligible as a childcare worker. Please follow the lead of the municipality of Sudbury. They are including all home daycare providers in a second phase. You have the power to interpret the wording of phase 2, which can keep all childcare workers safe during a pandemic. Please do not pick and choose what kind of worker. Include all of us. Consider the vectors and how many children are in the same group. Daycare center staff need to be prioritized and receive the vaccination first, as they have more exposure, but the cleaning and the cooking staff in centers also need to be vaccinated. Home daycare providers, whether they operate independently or with a license, should also be included in phase 2, as should nannies. Please use your collective power to support my sector. Childcare is an essential service and we all need to be vaccinated. Thank you for taking the time to listen.
Thank you for coming out and sharing your viewpoint on this. I see Member Menard has a question, so I'll turn the mic to him.
Thanks very much, Chair. I just wanted to say thanks for your excellent presentation, Velvet. It's helpful to hear. The other groups, I think, over half of the city's children are actually in independent, unlicensed childcare facilities, as I understand it. So there's quite a lot there that should also be prioritized. And I guess that's your main ask, is that it's not just the licensed facilities, it's unlicensed at home, people that are caring for children that should also be included. So perhaps that's something we can ask of staff in terms of the prioritization when they do go back to that sequencing with Mr. DeMonte, and when they make those decisions, that be part of their decision-making process. So I just wanted to say thank you.
Mm-hmm. I just want to make it clear too that I do think that center-based workers should have priority over home daycares, because we only have either 5 or 6 children, so it's less exposure, whereas daycare centers can have 24 children in a group. So
okay, thank you.
Thank you, and thank you, Member Menard, for the question. Our next delegation is Kim Rogers. Good evening, Kim. You have 5 minutes.
The delegate is on mute, Chair.
Oh, sorry. We can't hear you.
We'll start again. Good evening. Thank you, committee members, for allowing me this opportunity to speak to the importance of prioritized COVID-19 vaccination to essential workers, specifically early childhood educators who cannot work from home during provincial shutdowns. My name is Kim Rogers, and I'm a registered early childhood educator with 35 years experience working in group-based early learning and care settings. Early years professionals, both in group and home-based settings, have noted that, again, the fight for equity, acknowledgement, and community respect rests on our shoulders. At times, our ECEs and childcare workers and the support staff to whom we rely upon, although we appreciate all of the massive challenges that Ottawa Public Health is facing, at times we feel that we are only validated by members of the working community who have young children actively in our care. As early childhood professionals, we have dedicated ourselves to the health, safety, and well-being of children and families, both before COVID and during, and will continue to do so afterward. As essential workers, though, through every provincial shutdown, however, working directly with children in settings where physical distancing is impossible, we find ourselves again left on the sidelines when it comes to being unconditionally valued and publicly acknowledged for our efforts providing emergency care. Priority to vaccines based on the type of building we work in or the postal code in which we live is frustrating and divisive and affects the well-being of all of us equally. For all educators still required to operate on site while not being considered as a priority for immediate vaccination speaks to this latest oversight. When we needed a strong voice to advocate for us, Dr. Vera Etches and Jason Samarin stood publicly and actively on March 16, 2021. They thanked the early years sector for our dedication and due diligence in helping to contain the spread of COVID-19 amongst the youngest members of our society. And for that, we thank you. We need you to stand and advocate for all of us, Dr. Etches. In doing so, we also need a plan and an inclusive advocate for all educators in Ontario. It's now time for Ottawa Public Health to stand tall as the leader they are and create an equally accessible, fully inclusive, and logistical system of vaccine pre-registration for all educators in a cohesive manner in advance of the resupply of vaccine. A registry of names, contact information matched to potential locations of accessible pop-up clinics needs to be established so that those of us on the floor working 9 to 5 know what to do when the time comes. Supporting our families and their children while keeping our own safe as well is in everyone's best interest. So to conclude, childcare keeps people working and our economy relies on it. Early childhood educators must be prioritized for vaccinations against COVID-19 without delay if we want to provide sustainable service to families and our community. Thank you for allowing me this time to share my concerns and requests, and many educators besides myself and early learning support staff look forward to hearing OPH address the issue of prioritized vaccine access to early educators on a more publicized forum. Thank you for your time.
Thank you for your contribution tonight. I don't see any questions for this delegate. Our next delegate is Adam Kula. And Adam, you have 5 minutes.
Thank you. I just wanted to say thank you all for listening, and I know you have heard quite a bit about us and our asks for priority vaccine registration for essential workers, and I hope that you all recognize that it is quite an important issue to us in the community. My name is Adam Kula. I'm a university student, and I'm also working part-time as a medical assistant. As such, I've been fortunate enough to be able to get my first dose of a COVID vaccine. Today, I'm going to be speaking on behalf of all of the cashiers, fast food workers, postal service workers, and all other essential workers who are unable to be working from home, who've been putting themselves at risk of exposure every single day by going to work to service our communities and keep our economy afloat through this pandemic. Many of these workers are a younger population like myself and may find the act of speaking up daunting. These workers do deserve to have their voices heard for their role in helping our community. As mentioned by Dr. Etches in her verbal report, these people working in the front lines who are unable to work virtually or from home are one of our highest risk communities for both infection and transmission, due mainly to the amount of contacts they have every shift. Increasing this risk further is the fact that most of these essential businesses have not been able to enforce strict health regulations, if any were put in place at all. I know that many of the stores have had difficulty even enforcing masks for most customers, which is the most basic level of protection from this disease. Why is it then that these essential workers are still waiting for vaccine eligibility? Many here have discussed already, these workers are the backbone of our community and deserve to be able to at least register for vaccination if supply does not allow for vaccination as is. How is it possible that we can be considering vaccinating those aged 40 and up, a demographic that is very healthy and for the most part may be able to work from home, but not our most exposed workers? We have seen the rise of highly transmissible variants recently in our communities that can affect all ages. Our vaccine distribution should be changing to reflect that. We should be prioritizing those who work in fields with high exposure, including all childcare workers, such as educators and daycare, grocery and fast food workers, transportation and postal workers as well. It is time for our local authority to prioritize the communities we know to be most at risk of infection, regardless of their age. Thank you all for your time and your consideration.
And thank you very much. I don't see anybody with a hand up, Adam. But again, thank you for participation. And our next delegate is 7th on our list, and that's Catherine Desplomb. Did I say that mostly right? Hope so.
Yeah, mostly.
And you have 5 minutes, Catherine.
Okay. All right. My name is Catherine Desplomb. I'm mixed race, Black and white, and the child of first and second generation immigrants to Canada. I grew up in South Keys. I have a PhD from Duke University and have returned to Ottawa on a Banting postdoctoral fellowship at Carleton University. I serve on the board of directors at the Digital Arts Resource Center, formerly known as SAW Video. My delegation represents only my views. I implore Ottawa Public Health to remove structural barriers to COVID safety instead of adopting the language of our Premier, who has encouraged Ontarians to blame immoral and unruly non-compliant individuals. Compliance to regulations is inhibited by the phenomenal instability of Ontario's irregular openings and closings announced with little notice, and the regular restructuring of lockdown and shutdown and so on rules. Commercial rent relief has been either absent or very opaque. Non-compliance can be explained by commercial non-compliance can be explained by a profound absence of measures to support many of our small businesses, which are swimming in debt and closing at rapid rates. We need a genuinely public health intervention rather than a punitive emphasis on compliance to ever-changing rules. I ask that Ottawa Public Health prioritize essential workers as primary and initial priority in your phase 2 rollout, as announced by Dr. Etches today. If you can, and you have opened up vaccination appointments to 40-somethings, you can invite essential workers to book too. We are well aware in Ottawa, in Ontario, and indeed across North America that COVID-19 has preyed on Canadians who are already victims of structural adversity. We know that BIPOC, and especially Black Canadians, are as overrepresented in COVID infections and death as we are over-policed. We know that essential workers have very high occupational exposure to COVID-19 in their workplaces, and we know that this disproportionately affects racialized Canadians, the precariously employed, and women who are overrepresented in caretaking employment. The message this sends to me, and that I know you don't mean to send, as a Black Canadian who grew up in an immigrant high-risk neighborhood, and the message I'm sure it sends many more, is that our safety and survival is not a priority. We are currently over-policed on the one hand and chronically medically underserved on the other. Any advocacy to improve the safety of frontline working conditions has been ignored and rebuffed provincially. Ottawa Public Health has an opportunity to send a different message to its residents. I implore you to prioritize vaccinating residents by occupational risk of exposure to COVID, regardless of age, in your phase 2 rollout. Yes, while I am relieved that my parents have both received their first vaccination as residents of the high-risk K1T area, and while it alleviates their anxiety, their risk of exposure is very low. They both work from home, and this low risk of exposure is widely shared by their age group. Though I recognize that they're more likely to require hospitalization if they did contract COVID, there are many ways to lower COVID transmission. One is to lower the risk that they might encounter COVID when they do leave the house to buy groceries or fill their tank. These workers selling them groceries and filling their tank have put themselves at tremendous risk during this pandemic and are compensated with no paid sick days, minimum wage pay, no benefits, and have been regularly laid off and rehired throughout this pandemic. We need to send a different message that their work is valued. They are not getting this message anywhere else. Though COVID is physically, emotionally, and mentally devastating to all of us, I also need to emphasize that the BIPOC community is experiencing layers upon layers of trauma right now. I have sat alone in my apartment reading the news, bouncing between police killings and our disproportionately high COVID rates among the Black population, thinking, this is it. They're finally going to kill us all. I want to share my racial perspective with you. The existential dread amongst the BIPOC community is a crisis level that you may not be able to understand in your bones and your heart the way that I and many Ottawans do. We're afraid of dying right now, all of us. On behalf of my BIPOC siblings who don't have the time or resources to speak to you today and who are not represented by the racial makeup of this board, I implore you to show us you value us by taking action. Essential worker vaccination is in many ways a racial issue. We are terrified, especially as ICU doctors prepare to triage incoming patients by the end of the month, a move that we know and that has already in the US disproportionately disadvantaged the disabled and BIPOC communities. I understand that Ottawa Public Health faces many hurdles, not all of which are evident to the average Ottawa resident, myself included. Ontario is at a terrifying moment of crisis, and we really should not be here over a year into this pandemic. Please vaccinate by occupational risk of exposure. Thanks.
Thank you. Just right on the 5 minutes, so I appreciate that. And thank you for sharing your perspective. It's not one that we've heard tonight already, so thank you for that. I don't see any hands up, so we will move on to our next delegate then. Which is Mohammed McGill. I hope I said that right. Mohammed, you're muted. We can't hear you. There you go.
Hey, how's it going? It's
you have
Mohammed
5
McGill.
minutes, Mohammed.
Okay, so thank you for having me today, Chair, members of the board, and a member of the community. So my name is Mohammed, and I am an Ottawa resident. I'm here today to speak to you about a few important elements and provide my personal opinion and experience with the pandemic. Also with respect to with today's agenda. So before I go in details, I would just like to take a few seconds to thank Horizon Ottawa and many other community groups for encouraging us to speak at these meetings and voice our concerns to our elected officials regarding COVID-19 restrictions as well as improvements. Now, so thank you. The Ontario government, as you guys are all aware, has issued a new restrictions regarding the stay-at-home order, increasing the police surveillance, and to enforce. Basically, I would, in my perspective and the perspective of the community, it is purely unreasonable, and it is unacceptable, because Black and Indigenous people, such as myself, are subject to racial profiling and aggressive pressure from law enforcement, or pretty much being harassed by law enforcement. So we urge the Ontario government to address and retract this order, and because the community is frightened and scared to even go out for an essential trip. Also, they also have failed in the general handling of the pandemic, such as preventing the surge in cases and rolling out the vaccine. Now, our seniors are sick and tired of being told to stay calm without proper prevention measures and protective guidelines. Again, the Ottawa Public Health role is to maintain control of the spread of the virus in our city. And we thank you all for doing your best as you can. So we are glad to have you guys working on our behalf to protect our residents. Now, it has been a rough year for a lot of us, and the community demands the Ottawa Public Health officials to treat people equally without favoritism or discrimination when it comes to the COVID-19 vaccines, as well as any other health services. So in other words, to basically provide access to vaccine and mental health services to the most at-risk communities, especially our essential workers. They are very important in this fight in this pandemic, and we need to protect our essential workers. So basically what we demand is the Ottawa Public Health Board to basically provide a precise municipal health policy and guideline to basically explain and in detail and providing such as the rollout to the healthcare sector as well as the higher hotspot communities in order to basically protect the spread of COVID. Now we all know seniors, especially our homeless people, do have a physical, some sort of emotional toll of COVID. So their physical and emotional well-being is important to all of us. So we ask to treat us people good. Now, we must do more to prevent further outbreaks in the Ottawa healthcare, as well as childcare and educational establishments. For the sake of our children, the recommendation of enrolling in remote learning has been very effective, I would say, in decreasing the surge in community spread. Data have confirmed from the provincial or the local data information that we have available to us online that the number of school establishments being closed and being provided remote learning did provide a significant decrease in the surge of cases of COVID-19. So we recommend delaying the return to in-class learning for better outcome. Now, the last point I wanted to talk about, which I already elaborated on, which is the public health, Ottawa Public Health, sorry, COVID-19 vaccination program. So what we want is for you guys to establish the administration of 1 dose to every adult who wants to be vaccinated and prioritize the vaccination at a higher capacity for individuals anyone who's an adult can obtain their vaccine, and also have it available at local pharmacies. Also, there's been other recommendations by other fellow delegates regarding setting up.
Mohammed, you're at your 5 minutes, so I'm just going to give you a couple of seconds to wrap up, if you don't mind.
Right. So I'm just going to wrap it up at the end. I just want to congratulate you guys. However, I just want you guys to be, focus more and prioritizing the vaccine to everyone and to any adult that wants to get their vaccine. And we must continue to promote the benefit of vaccine and deploy mobile vaccination units to low-income communities and not only focus on rich and healthy neighborhoods. So I have no further questions, and thank you for having me today.
Well, don't go just yet, Mohammed. Member El Shantiri has his hand up. He'd like to ask you a question.
Sure.
Assalamu alaikum, Mohammed.
Wa alaikum salam wa rahmatullahi wa barakatuh.
So I heard you loud. I just had to comment about your comment about the police and the power to police to stop people. I think you heard most police services in the province has declined that order, or in a way they had announced it, they will not practice that, because we spent 20 years making sure police doesn't stop randomly. And I know that order came on Friday, was a surprise to a lot of police services. As someone who still sit on a provincial organization, I can tell you that was basically announced by majority of police services in the province. So I just wanted to share that with you, but I want to thank you for your presentation, and Ramadan Mubarak, Mohammed.
Thank you. I appreciate your comment, Mr.
Thank you, Member El Shantiri. I don't see any other questions, so thank you, Mohammed, for coming out tonight. Our next speaker is Jessica Scallon. Good afternoon, or good evening, Jessica, and you have 5 minutes.
Thank you. Thank you so much for accommodating us to speak, and thank you for the leadership of Dr. Etches. Thank you. I'm a early childhood educator who's been working in Ottawa with infants for over 20 years. And I consider myself one of the lucky ones. I work in a unionized center. I have paid sick leave. So I know that if I get sick, I'll be okay. And I'm also very lucky to have a husband and a family. So I am in a position of privilege. But I'm here because we're tired. Our sector is worn thin. We're caregivers at work and we're caregivers at home. I'm sorry. I haven't been able to see my family. Hold my nephew who is 5 months. Meanwhile, I hold babies all day at work. Babies that cannot be masked. Babies that are all over me. I'm giving them bottles. I'm feeding them. I'm hugging them. I'm putting them to sleep. I'm changing their diapers. And I'm at risk every day. It's hard to get supply educators to work with us and put their own families at risk to work for minimum wage to be our supply educators in our cohorts. And so that is very tricky for us as well. We're worn thin. We don't know what we'll do if we have to call in sick and we don't have enough supply educators. So we're getting to a critical point. We've been working since last July. We reopened and we're tired and we need a break and we need the ability to have that break. I also worry about the risk I pose to my family, my daughter who is 10, my husband who works from home. And I worry when schools are shut down that we're still open. I worry about the variants of concern and the fact that we thought that childcare was safe, but now we're realizing that maybe we're not that safe. Anecdotally, I live in Centertown West. So my husband, who turns 50 this year, is eligible for the COVID vaccine. I am 44 and I work and I do all the shopping and I'm in a high risk position. And now, only now, as of yesterday, I'm eligible for the AstraZeneca vaccine, which is great. Meanwhile, my friends and family who've been working at home all day were on the line booking their AstraZeneca while I was at work holding babies and not able to do that. So I'm here today. My ask is that Ottawa Public Health make a specific motion to prioritize childcare workers, as other municipalities have done, especially in hotspots. And if there's not enough vaccine, then come up with a system where it's decreasing age. I know Dr. Etches was talking about the risk for those under 40. Well, I'm between 40 and 50, and I may not be 25 and super healthy, but if there's a vaccine enough to do some essential workers, start with a decreasing age. I also look at barriers to the booking system because we're working all day. We can't be on the phone trying to call pharmacies or trying to call in and get those things because we're working, we're holding babies and I'm giving bottles. I also ask that there is a prioritization of vaccination eligibility based on work address as well as home address. I understand that the risks, but for essential workers, we have a risk when we're in a community because we're providing services for that community and they are the ones that are bringing their children to us. And then I also ask, a unique ask is vaccinating us on the recommended schedule like healthcare workers. So when we do get our call, if we can be vaccinated quicker, fully vaccinated quicker than the general population, I think that would help retention. It would help us in the field to feel more secure and safe and allow us to do our jobs. Thank you.
Thank you very much for your presentation. I don't see any questions. So I'll call our next delegate, which is Adrienne Chenier, and that's delegate number 10. Good evening. You have 5 minutes. Thank you.
Thank you to the of the Board of Health for the opportunity to address you all on an issue of critical importance, the childcare worker safety. I salute and thank all of you at the board for the hard, unending, and sometimes heartbreaking work done to date to protect citizens of Ottawa. My name is Dr. Adrienne Chenier, and I am an occupational health and safety specialist with CUPE, Canada's largest trade union. Most of our more than 700 members work in the public service in municipalities, education, healthcare, social services, airlines, communications, and more, and including childcare workers. And it is on their behalf that I appear before you this evening. No society or economy can function properly without the work of skilled and trusted childcare workers. They care for a vulnerable young. I call upon you, Dr. Etches, and you, honorable members of the Board of Health, to lead. I call upon you now because our calls for help and support have been largely ignored by those who have a duty to care. I call upon you and the members of the Board of Health in Ottawa to exercise your powers and to protect childcare workers by prioritizing their access to vaccination now. Every day, childcare workers receive and care for children for workers who cannot stay home to work. These children cannot follow public health advice. They don't keep their hands clean. They don't stay the requisite 2 meters distance. They can't wear masks properly, and they cannot remain home alone. These children come to childcare workplaces, exposing each worker to what they brought in with them. We know vaccines save lives, but when childcare workers have tried to register for vaccines in phase 2, they've been turned away. We understand shortages, but we do not understand the lack of prioritization. Childcare workers are currently in an untenable and precarious position, and they need leaders to consider their welfare, not just their usefulness. It is an undeniable fact that the measures in use to date have not been successful at COVID-19 containment. The rest of the world is watching to see what steps will be taken by those in leadership roles to control the spread. But in Ontario, we're left with a giant gaping hole in our toolbox. Ontario does not acknowledge the risk of spread from aerosols. This refusal to acknowledge scientific evidence and act in a manner consistent with the precautionary principle leaves workers in harm's way. We ask that you advocate for this change with the provincial government. At this moment, when the rest of Ontario can stay home to follow public health advice to remain safe, childcare workers leave the sanctuary of their homes to take care of Ontario's children while their parents or guardians go to work. There is likely a childcare worker in a high-risk community being exposed to COVID-19 right now as parents rush home from work to pick up their children. We don't blame stressed out parents who need to work to put food on the table. For operational and economic reasons, those parents need childcare support right now so that they may perform their essential duties. With no paid sick days for many essential workers, it is likely that these exposures to sick families will continue to occur. But what does this mean for childcare workers? It means that they are one step removed from each and every one of those families. It means that they are only one step removed from each and every one of those workplaces. It means that they are in direct contact with members of households where there is still a high level of community transmission, the degree of which is most often unknown. It should mean that they're more protected because of these facts. But childcare workers cannot access vaccination unless they reside in an area associated with a hotspot postal code. Ontarians have been listening to news reports lamenting the spread of the under 40-year-old age group, an age group that contains young families that need access to childcare services. A quick scan of workplaces that are still open now reveals workplaces like hospitals in outbreak, long-term care homes in outbreak, grocery store workers, where every household must attend. All places where COVID-19 may be found, circulating silently, and whose workers would likely need childcare. COVID-19 is spread through interactions between people. There are no categories of people who cannot transmit COVID-19. It is true that children are unlikely to develop severe illness, but that does not mean that they cannot transmit COVID-19 to those vulnerable. In every case, while the risk is low, it is never zero. The current 103 outbreaks in childcare centers really drives home this reality. As the pandemic is raging around us, the Minister of Education has committed to prioritizing education workers, but left childcare workers unseen. We advocate for all education workers to be prioritized. However, as schools remain closed, school board educators remain at the front of the vaccination line, with childcare workers who are still going to work have not yet received support from Minister Lecce. Childcare workers.
You're almost at your 5 minutes. Could I ask you to wrap up, please?
You're correct. However, Dr. Etches and members of the board, this is something that is in your power to redress. Today, you could pass a motion to change this reality for all childcare workers in the Ottawa public health catchment area. You could take heroic steps to protect childcare workers by granting them priority access to vaccine. You can show leadership and respect to workers who are often left to fend for themselves. We ask that you take these steps to protect the health and safety of childcare workers while they take care of our vulnerable children. Thank you, Dr. Etches and members of the Board of Health for taking the time to listen to my comments. I would leave you with this comment. As a society, we can work only because childcare workers do.
Thank you. I have a quick question for you. I wasn't sure I caught your comment earlier on. Did you say that the provincial government does not recognize that COVID spreads by way of aerosol spray, or did I mishear you?
I'm saying that in the occupational guidance that we get, aerosol transmission is not obviously recognized.
Dr. Etches, can you comment on that, or? You're muted.
Yes, thanks. Thank you for coming. I think there's probably a degree of risk associated with aerosols, and most transmission is droplets, so that may be more emphasized, but there is a risk from aerosols. It is taken into account in our case and contact management follow-up when we think about exposures. We do consider shared airspace, potentially significant exposure when people are sharing that airspace for a longer period of time. And it is something we do recommend schools and workplaces and others consider in terms of increasing ventilation as much as possible, because the more air exchange, the better. So I can't really speak for which provincial things you would like to see changed, but I can reassure you that we do locally acknowledge that we need to consider aerosol spread.
Thank you, Dr. I just appreciate that clarification. Our next delegate is Chris Lee, and good evening, Chris. You have 5 minutes.
Hey. So I want to say hi. Thank you for the board to hear me today. My name is Chris Lee. I'm a member of Horizon Ottawa and a union rep at SCIU Local 2. Our union rep represents frontline workers, including hotel workers, security guards, and most of the cleaners and janitors in the city of Ottawa. Councillors, the good people who clean City Hall, are members of our union. I'm here to express the crucial importance that Ottawa Public Health recognizes the need to ensure that the workers that we call essential get prioritized to their access to vaccination starting as soon as possible. I'm talking about the cleaners, say at Skyline Towers, a complex of buildings that houses Agriculture Canada offices. In late March, the cleaning staff of about 15 workers saw an outbreak of positive tests emerge over the course of a couple of weeks. A reasonable person would see the rate of infection there and conclude that the building should be closed for a few weeks to avoid further spread. That was a conclusion that was made for the government workers who find their offices there. However, our members got no such relief. As essential workers, the remaining staff had to continue to take risks with their health and that of their families while hearing about new strains and watching infection figures rise daily in Ottawa. They commute to work, or they commute and work in circumstances they know to be dangerous to clean these empty buildings. The provincial government has failed to give essential workers additional paid sick days, to give them essential pay, and it continues to fail to prioritize workers who put themselves at great risk, where many of us have the luxury of working from home. This city has the discretion to prioritize these workers, and it's important that we act. 2 years ago, Ottawa faced another crisis, the flooding of the Ottawa River. And while the flooding was widespread, we acknowledged that there were communities with greater need for aid, including Councillor Kavanaugh and Councillor El Shantiri's wards. People from all levels of government showed up to help without an argument about jurisdiction. During the pandemic, we have prioritized the elderly and the senior residents and continue to roll out vaccines for the 40+ cohort. It's past the time that the city recognizes that while we all face the pandemic, the communities in peril are not those who own riverfront property this time. They are those who take greater risks in going to work every day than most of us are comfortable with. And we can do something about it where other levels of government have failed. Many workers fall outside of the age cohorts and geographic areas singled out and facing lower supply. Those with the ability to navigate the system will continue to precede essential workers unless specific efforts are made to prioritize them. Our members are exhausted. They're confronting real contact with the virus daily. They need to see the city take action on this in the next phase of rollout. On behalf of SCIU Local 2, I'm standing with other representatives here today and asking the Ottawa Public Health to use its discretion to get the workers that we call essential access to the vaccinations they need to feel safer and breathe a sigh of relief finally. Thank you.
Thank you, Chris, for coming out tonight. And if I could just clarify something, this board did take a position on paid sick days at our in a recent board meeting, and we unanimously support it. That's one measure that should be implemented, and we conveyed that position to the province as well. I see the councillor, or not councillor, sorry for tonight, Member Bernard has a question for you, Chris. So if you can just hang on a second.
Sure.
Thanks very much, Chair. And yeah, Chris, you'll also know, of course, Board of Health did take that position. City Council did not, unfortunately. I think your point is well taken when it comes to the need to come together, all of our orders of government, when we're battling something like this. So I wish our council did the same, but that wasn't the case. Might be different if we revisited that decision today, I think. With regard to your delegation, the province had come in and said that the AstraZeneca would be delivered to the pharmacies for those 40 and older. That seemed to go against the original plan that was put out, that would have seen essential workers vaccinated in phase 2, which we seem to have gone into as of April 6th. So I guess in your estimation or your view, what could have been done differently by both the province and ourselves at this time, instead of that 40 plus vaccination schedule that's now been put in place?
I mean, I think it kind of speaks for itself. We have workers that walk around every day and get called essential when it's convenient for the government, and then get ignored when it comes time to get them vaccinated. They know how to label these workers. That's not a problem. We need to take action and make sure they are actually prioritized, and not just hope to capture them through other means, and continue to let the institutional barriers that keep people who need vaccines from getting them from playing a factor. I mean, I think what I've heard today is good lip service, and I'd want to see action change. And it's kind of surprising to hear that there is a cohort of 40-plus-year-olds that is being named as a priority at this point, before, ahead of working people who have been, going to work every day for a whole year and having to risk everything. So I just think that there is the ability to capture or to do something specifically towards this group of people, and it's a large group of people, and there is going to be some self-selection. I understand that, but I face the reality of talking to people who have to go to work to make a living. And they don't know what to do. Their building, when they hear of an infection in their building, they get scared, and they don't know what to do. And then we're vaccinating 40-plus-year-olds. So I don't know. It just seems like there is action there to take. There is discretion that the OPH has, and I think that it needs to step up here for these workers who have been suffering for a long time now. Thank you.
Thanks very much. And I think you're seeing that push from us, from Dr. Etches, and that's going to continue, and it's going to be a quick turnaround. We can start to get essential workers in that queue as soon as possible. So appreciate you being here.
Thanks, Sean.
Our next delegation after Chris is Kathleen Arsenault. Good evening, Kathleen.
Good evening.
You have 5 minutes.
Hi. Thank you so much for the opportunity to speak this evening. I am a childcare coordinator working in Ottawa's East End, and I am part of the delegation just to express my concern for the health and well-being of my professional colleagues and their families, as well as my own. I'd like to just put it into context for you. When the transfer from community and social services to the Ministry of Education occurred in childcare, the event ignited childcare advocates to perceive this mobility as a final acknowledgement that learning is recognized as a lifelong beginning at birth. It's a long overdue public recognition of childcare and its practitioners and its beneficial impact on learning and caring for young children. Families and their communities would finally unfurl. And it's unfortunate that up until now, the childcare sector has not quite received the residual glory from the Ministry of Education it once anticipated. And when I say this, I acknowledge and thank Ottawa Public Health and their leadership and guidance. And I especially appreciate the collaborative nature of working with children's services. I think that as two organizations working together, the responsiveness has been incredible, and I am very grateful for having that opportunity to be able to communicate concerns and needs through children's services and have that that responsiveness and working together to try to solve that problem. And I'm putting it into the context that as a childcare worker, it's unfortunate that up until now, the childcare sector has not quite received the same sort of impact from the Ministry of Education. And so when I say that, it took COVID-19 and the pandemic to glaringly reveal the economic merit and the critical essential services that childcare agencies and professionals provide to Ontario's workforce to really herald its worth. So unless the Ministry of Education in particular actually addresses all of its divisions with mutual respect, acceptance, and consultation in the face of crisis, its umbrella of responsibility will continue to be heavy, a very heavy weight to lift if a whole division is unacknowledged in its contributions. Time and time again, Ontario's RECEs and childcare workers in licensed nonprofit organizations seem to be regarded as an afterthought. When I read or listen to Ministry of Education's, Ontario's Ministry of Education's messages with the word partnership and phrases like valued leadership, it shrinks in meaning when coupled with backlash of media coverage, warnings of zero tolerance, severe penalties of non-compliance, or worse, no mention at all. So that afterthought or not being included is something that is actually a complete weakness. And it's something that is, I think, imagine a whole sector of registered ECEs and workers whose soft underbelly is a labor of love, not worthy of address. It is clear invalidation or undignified or poorly conceived strategic endeavor to chastise without cause, to demean or devalue a profession that in a type of public denouncement or worse, virtually ignore a population of predominantly female workforce. That is very hard for someone that has been in the field for 25 years to stomach. Activating the childcare system voice by respecting its professionals, valuing the economic evidence, and employing a solution-based approach to new crises may unburden some of the ministry's plight and that it's endured during the pandemic. Mindful consultation may lead to healthy engagement and creative thinking, which may address new challenges by reaching the consensus with all of its players in education. Represent childcare in early years as a real equal partner within the whole Ministry of Education, and we will be enhanced. Neglect it or miss it, and it's a missed opportunity. And I feel that this is really important with Ottawa Public Health because that tragic ignorance or lingering disrespect bears an unquestionable consequence of threatening a whole sector's overall health and well-being when one considers the vaccination process. From the first announcement of the pandemic, RECEs and child care workers rose to the challenge, surpassing the encumbrance of COVID-19 health.
Kathleen, you're at the 5 minutes, so if I could ask you to wrap up, please.
I sure can. I emphasize the significance of setting a date for facilitating vaccination rollouts for their practitioners. Do it now ahead of the COVID curve, and make sure that childcare workers matter today. Don't forget the heart of the critical players, helping our littlest residents understand the impact of the pandemic. They're shielding them with care, and they're empowering them with prevention knowledge for the future. Thank you so much for the opportunity to speak this evening.
And thank you for coming out tonight. I do not see any hands up, but I am going to have to ask Councillor Gower if he could move the motion to extend the meeting past 7 o'clock, because that was our 12th delegate and we have another 13 to go. So we'll need to extend the meeting time to address that. Member Gower, please.
Thank you, Chair. Il est résolu que, be it resolved that the Board of Health approve that the meeting time be extended past 7 o'clock p.m. pursuant to subsection 8(1)(c) of the procedural bylaw.
Thank you very much. Is that carried?
Carried.
Okay, thank you very much, everyone. Our next delegate is Tara Shapransky. And Tara, you have 5 minutes.
Hi, everyone. First and foremost, I want to say good evening and thank you very much for taking the time to listen to all of us this evening. I am not only here to discuss the vaccines for early childhood educators, but also to differentiate between an educator or teacher and the early childhood education and childcare sector. That makes a big difference in terms of wording, as many of my colleagues have mentioned before. And I come to you wearing many hats this evening. I sit on both the Young Workers Committee for my union, which is Public Service Alliance of Canada, which represents a large number of childcare workers, as well as a member of Childcare Now, Ottawa. And I also come to you as a concerned member of the community. So the past year has been very tough. There is no doubt about that. And there's been many unforeseeable circumstances that have befallen to Ottawans. You have seen the emotions and tireless desire to take care of others by my childcare colleagues tonight. And during these times, I know that there's nothing set in stone and everything is constantly changing on the drop of a dime. However, I think we can all agree that in today's society, childcare is a much needed act, whether it is at the school or whether it is a home center or an actual center, which is the word I was looking for. So prior to the COVID-19 pandemic, parents did not think twice about sending their kids to school or daycare. And for those who have school-aged children, many of them are old enough to understand that masks are important. They wear them, or they are in the younger grades, grade 4 and under, in which case they are in some kind of isolated bubble where contact tracing is a lot easier. When it comes to ECEs, from what I have heard, they are in, and many of you have heard this evening as well, they are in a facility where they're not able to distance. They are not able to have children wearing masks. They don't want to wear the mask, they take them off. And anyone who's worked with kids knows that it is very hard to get them to do something that they don't want to do, even if it's for their own good. So while on the priority list, teachers and educators have been deemed essential, ECEs and childcare providers have not. They are not specifically listed in their own right, and therefore there is some ambiguity as to whether or not they are able to get vaccinated. Many of my ECE colleagues here tonight as part of Childcare Now and beyond have mentioned that they are not in a designated neighborhood or not in a designated age category. And by not specifically adding that wording, it creates this barrier that the ECEs cannot access the vaccines that they so desperately need to help our society keep functioning. Schools and teachers have been mentioned, and because they are this unionized giant board thing, it seems that the ECEs are forgotten. And because they are smaller and less centralized as part of what we consider education in our society. While I do not disagree that teachers are important to get vaccinated, I do, however, disagree with the lack of terminology around ECEs and childcare providers, such as nannies and home daycare providers as well. So not only do many of the ECEs and childcare providers work in hotspot areas, as we call them, they are not able to access it for various reasons unless they have another condition that provides access to the vaccines. It is really important for them to be listed as priority in order to get the vaccine so that our society can keep functioning, as we have heard many times over again tonight. So our ECs do everything that they can to keep our kids safe, engaged, and cared for, and lumping them together with a group where the teachers are in an almost safer environment is not fair to the ECs and invalidates the work that they do. For all these reasons, and the many that have been mentioned by many of my colleagues tonight, and actually I would also like to point out not just the ECs, those that have come forward to talk about essential workers as well, the frontline staff at grocery stores and things like that. Everyone who has come forward has mentioned a valid reason for having them on a priority list above those that mainly work from home. Like myself, as much as I am very happy that my parents have been able to get vaccinated, I work from home. It doesn't affect me the same way. So I do believe that the essential workers are quite important, and ensuring that all childcare workers are specifically mentioned as part of this eligibility and recognition for them to validate not only the work that they do, but their essential.
Tara, your 5 minutes is up. If I could ask you just wrap up, please.
Yeah, I got 2 more sentences.
Okay.
So it just validates them and it validates the work that they do. So it's very important. And I will also mention that as the capital of Canada, while other regions have been able to do this successfully and get ECEs and other childcare workers involved, I think as the capital, we should be doing a better job of setting the tone for the country and not following suit from what others are doing. And that is it.
Thank you very much. I see no questions. So our next delegate is Mr. Hirsch, Sam Hirsch. Good evening, rather, Sam. You have 5 minutes.
Thank you very much, Chair. So my name is Sam Hirsch. I first want to recognize that we're on the unceded, surrendered land of the Algonquin people, and thanks to the Board of Health for making an exception for us to speak to this issue tonight. And I want to thank all the childcare workers and other frontline workers who spoke before me. Your passion is contagious, and I feel the hurt and concern you're all feeling right now. I'm speaking to you all today wearing, 2 different hats. First, as some of you might know, on behalf of Horizon Ottawa, who has put forward a petition that garnered close to 600 signatures in support of prioritizing frontline workers, but also a bit through my work with the Amalgamated Transit Union, where I work as a night day job. For months, transit workers have been demanding to get vaccinated across this city and the country, and their wishes have fallen on deaf ears again and again. Every single day we hear about case after case, outbreak after outbreak, but governments continue to ignore them as they simultaneously tell us that they are essential. Members couldn't be here this evening, but they have picketed several times outside of the offices of MPPs, NOC Transpo headquarters, as the Ottawa local, simply demanding to work in a safe environment, and that means getting the vaccine, not in June, now. Members of the Board of Health, Dr. Vera Etches, I'm here today to ask you to take action. It has become utterly clear that our provincial government is completely incapable of managing this crisis, and as a result, people are dying across our city and Ontario. It's incumbent on you to act. Under Part 4 of the Ontario Health Promotion and Protection Act, you have the power to direct the city's response to an outbreak of communicable disease and take measures to ensure that spread is contained and harm is limited to the greatest extent possible. But to be honest, quite simply, to me at least, it seems you've not been doing enough. I mean, the motion just presented by Chair Eglai, for example, about non-essential businesses is a good example of this. It's a good motion, but under the Act, Dr. Etches has the power under Section 22 of the Act to close non-essential businesses herself. She doesn't have to write a letter to the Premier. This hesitancy is causing lives. Use the power you have. I mean, we hear the emotion of folks today. Our local leaders need to take action. It's frustrating to me that we're doing a review when we know people are dying at these non-essential workplaces. We know that cases are spreading here. You have the power to act, and you should use it. Dr. Etches, you have been doing a great job, and I understand that you're under a lot of pressure, but sometimes a job like this, especially in this crisis that we are in, requires you to be in an uncomfortable situation. You need to use the powers that you have and prioritize essential workers. It's not enough to tell them to take the AstraZeneca vaccine or tell them to get vaccinated when they can. They need the vaccine now because a lot of these frontline workers who are 20 or 30 years old may not get vaccinated for months. And quite frankly, a 45-year-old office worker who works from home every day is much less at risk than a 23-year-old grocery store worker. The provincial framework isn't working, and it is time for a made in Ottawa solution and to quite frankly, challenge this provincial government. Following their framework is costing us lives. You spoke about an equitable solution. An equitable solution includes a solution that vaccinates essential workers across the city, as well as more social support for workers. We know where this virus is coming from. It's not coming from people going outside and playing in parks. It's not coming from people breaking the rules or young folks going out and partying. It's coming from people who are forced to work at their jobs without the safety they need, like a vaccination. And continuing to deny them that makes everyone here complicit. There has been a huge influx of rhetoric from the city council, from our mayor, and even our public health authority at certain times around the individualization of this virus, that the cause of the spread is people breaking the rules. Well, it's not. The vast majority of people are following the rules. The largest outbreaks are coming, as Dr. Etches noted earlier in her verbal report, from places of employment. Just last month, in my experience, in an Amazon facility in Brampton, there were 600 cases of COVID in an Amazon facility that led to the death of a bus driver, an ATU member, Dale. It was completely preventable. The pandemic isn't the fault of well-meaning residents. It's the fault of governments, provincial, federal, and municipal, who have continued to ignore essential workers while calling them heroes. Our city government has not been immune to that. I appreciate the work that folks have been doing, but more can be done. We needn't be afraid to rock the boat a bit, especially if it is to save lives. A move today to prioritize essential workers can have a greatly positive effect on this virus. Essential workers need vaccinations, and they don't need them in a month, or 2 months in June, or 3. They need it now, accessible, and at their place of work. Thank you.
Thank you, Sam. I don't see any hands up, so we'll move to the next delegate, which is Manal Gali. Good evening, and you have 5 minutes, please.
Hello, thank you so much for giving time to talk today. My name is Manal Gali. I am an ECE and a member of Childcare in Ottawa. Thank you so much for the hard work you've been doing during the pandemic. Story time, changing diapers, tying shoes are part of the typical shift at daycare. Childcare workers play with the children, get down to their level, and try to engage with them. When children get hurt and or cry, the childcare workers try to comfort them. Physical distance is impossible at daycares. All childcare workers come every day to their work to support the families and take care of the younger children while the most of the people work from home. Since COVID-19 pandemic, working at childcare becomes very, very hard. The workers must wear PPE all day, and work with younger children with PPE is very, very hard. And we all know that younger children don't wear face masks at all. They also had to find alternative activities for the children to avoid any COVID-19 outbreaks. For example, they're not allowed to provide any sensory activities, and we know that younger children need those activities to learn and develop their skills. They do extra cleaning and sanitizing to avoid any outbreaks, but we still see more daycares on the outbreak list. The schools are closed to protect the students and their teachers. Why is it safe for preschoolers and childcare workers to be at daycares? We know that childcares are important to see an economic recovery. Childcare services support women in engagement in the workforce. If the childcare workers are considered as essential workers, please give them the priority to get the vaccine. They are at high risk of getting COVID-19 and carry the virus to their families at home. Thank you so much.
Thank you for coming out tonight. I don't see any hands up. Our next delegate is Bethany Leonard. And Bethany, you will have 5 minutes. Good evening.
Hi there, it's saying that my video is disabled.
Yeah, we can hear you just fine, but we can't see you.
Okay, 1 second here. Okay, great.
Oh, there you are. I can see you now.
All right. My name is Beth Leonard, and I am an outdoor educator, artist, and an employee of a locally owned and operated retail business. Today, I am isolating at home as one of my roommates awaits the results of a COVID test. If they test positive, I will lose my wages and do not qualify for the federal CRSB program. In addition, the outdoor education program I was running with a local school was canceled due to the latest stay-at-home order. I'm not questioning the importance of staying at home to save lives. What I am questioning a year into this pandemic, along with many members of the Ottawa community, is how this third wave could have been prevented and how Ottawa Public Health, along with City Council, must act on the following to address inequities of the pandemic response thus far. 1, bold advocacy and action in legislating paid sick leave. I'm aware that almost all of you unanimously voted in February in favor of asking Premier Doug Ford to ensure all workers have access to paid leave. And Dr. Etches, in your joint letter to Chief Medical Officer Dr. Williams, April 4th, it was recommended to legislate paid sick days in the list of enhanced public health measures. The message in support of paid sick days continue to be a dull cry from the Ottawa Health Board, as opposed to undeniable, radical, and forced actions of legislation. It is clear these decisions can't be deferred to our upper levels of government, who continue to prioritize the health of the economy and pump funding into policing over providing support for low-income Canadians. These Canadians have been largely feeding us, keeping our supply chain going, building and tending to our infrastructure, and caring for our citizens, young and old. It is your job to hold yourselves and our government accountable and to stop asking them and start demanding. And secondly, as many have mentioned tonight, vaccination of essential frontline workers in at-risk communities, regardless of age. Throughout the pandemic, workers of food services, the supply chain, education, childcare, transportation, some retail sectors and migrant workers have been required to serve the city while often being targeted as the reason for community spread. Despite being deemed essential, tangible action has not been taken to address their basic needs of a livable wage, job security, and affordable rent. Without support that ensures their and their household safety, which includes access to the vaccine, the current stay-at-home measures are ineffective. Staying home is only accessible to those who can afford to stay home, such as Ottawa's population of civil servants, high-income earners, and retired individuals with access to secure wealth. In response to the stay home, stop the spread message, I urge you to prioritize vaccination of those who do not have the choice to stay home and who have been in constant service of the City of Ottawa through this pandemic. In closing, as an outdoor educator, my job is to share lessons from nature, the essential and symbiotic relationships that sustain life. For example, the tall trees of a forest cannot exist or survive without the nourishment from the essential network of mushrooms and fungi that process and feed nutrients to the roots of a tree. What I ask is that you, as the tall and acknowledged trees of this forest, look down from on high to see what your roots connect to, follow those connections, and provide the essential nutrients to everyone who has been feeding your ability to exist, and to also recognize and advocate for those who have been disconnected from essential support networks. Our emergency health response must act on caring for individuals experiencing homelessness in Ottawa and addressing the policing of racialized communities and the insufficient support for low-income community members and essential workers. The health of our community ecosystem depends on it. Thank you kindly for your attention today.
Thank you for coming out tonight. and sharing your viewpoint. I see no questions. Our next delegate is May Mason. And May, you have 5 minutes.
I'm speaking today on the unceded and unsurrendered lands of the Algonquin and Anishinaabe peoples. With workplaces, especially low wage and high density jobs, schools, childcare being where folks are indoors and undistanced, therefore a main driver of the current COVID wave, we need to make drastic changes to the current public health approach. Folks who can't work from home are putting their health and their family's health on the line. It is low income, racialized, and high density households that have been and continue to be hit hardest by the pandemic. This is not random. Public health measures for the past year have failed to protect these communities and instead have made them vulnerable to contracting and spreading COVID. Yet Ottawa is not prioritizing vaccination of these workers or their families. Without mandated paid sick leave and vaccine priority, these communities will continue to be made vulnerable to contracting and spreading COVID. I'm a middle-class white student who learns and works from home. I'm immunocompromised and have never left my house except to grab curbside pickup in this recent wave. I, like many of you, have the power to limit my contacts. I have the freedom to prioritize my health and to stick to public health measures. This is not the case for most low-income workers, fellow disabled folks, and many Black, Indigenous, and people of color. I demand change. This is deplorable. We need action now to value the lives of all Ottawans, not just those who can work from home, who can isolate from others when sick, and who can afford to miss work. Instead, it has been made abundantly clear that this city, province, and country values the labor of BIPOC and low-income people over their lives. Without measures that equitably protect all Ottawans, health committees are masquerading as champions of public safety and health. There is so much blood on the hands of every decision maker who is swayed to the interests of profit, the economy, popularity, and reactive measures like policing over preventative measures and ultimately the health of their constituents. This city is in a major crisis, and the only way out of it is by listening to those who have been most adversely and most violently impacted, as well as the healthcare workers who advocate for their interests. Which means it is time to mandate paid sick leave and vaccine priority to those who cannot work from home. Immediate action is needed and accountability needs to be taken. I would like proof that the current vaccination framework is ethical and equitable. I would like data that shows the vaccination rates of postal codes compared to those with the highest spread rates, because the data I see coming out of Toronto has proven that the current rollout is inequitable. The last point I would like to make is that we are in a crisis. We heard a lot of people talk about rules and procedures earlier this evening, cautioning us even that the participation of the public in this meeting is beyond its regular breadth, as if to remind us we should be thankful that this vital discussion has been accommodated. When engaging with city committees, I frequently encounter this type of narrative. I'm often reminded of rules and jurisdiction. I'm tired of this narrative. Now is not the time to pander to the rules and the jurisdiction. Now is the time for action. People are dying, entire families are getting sick, folks are forced to choose a paycheck or to follow public health measures. Almost 50% of COVID hospitalizations at QCH right now are people of color. Stop repeating the rote recitation of individual-centered public health measures. This is a systemic issue, so stop throwing up your hands when the system doesn't accommodate what the communities you've made most vulnerable demands of you. It's time to vaccinate those you failed so far, people who can't work from home, who can't afford to miss a day of work, and BIPOC residents. It's time to fight for paid sick leave as city leaders and as human beings. I'm a student who cannot leave their home, yet I'm writing letters, attending meetings, supporting grassroots, organizing in my community, supporting mutual aid. And you, those with far more power, how are you not doing more than a repetition of what has already failed us? I ask of you to reflect. Why do I think following provincial frameworks is the only way forward? What are the risks of this mindset? What can I do outside the provincial framework, one that has kept me safe, to change the trajectory of this pandemic, to assure the rights and well-being of those this framework has failed? Why do I ask residents to adhere to public health measures when I know they don't have the power to make those choices like I do? Why then am I resistant when residents ask me to reach beyond my own power?
Thank you, May. Right on 5 minutes. I don't see any hands up to ask a question, so we'll move to our next delegate, which is Kyla Tanner. Good evening, Kyla.
Good evening. Thank you for having me. I want to thank the board for the opportunity to speak here and appreciate the verbal update from you, Dr. Etches. It responded to my main reason to be here and really wanting to speak today. So a lot of my points have actually been spoken already, I think, more eloquently than I could myself by the other speakers. So I'm just going to be quite brief in my statement, but wanted to lend my voice to those that have made strong points tonight. My request to speak was spurred in response to the provincial announcement on Friday that the increased police powers were a response to a public health crisis. And while I understand that the city doesn't have power over the province to change that, there's still a role to be played here in Ottawa, which is prioritizing vaccine distribution to the frontline workers and at-risk communities, regardless of age. So I appreciated hearing what OPH is doing to reach the at-risk communities in the verbal update, and I look forward to reading the report. So please consider this, further request from the public, and that I just wanted to note that I feel strongly that the following groups should be prioritized. So those living in the most impacted communities based on the city data and not maybe the provincial data, perhaps, and education workers, childcare workers, transportation workers, food workers, and retail workers for businesses that are still open. So I'm just asking to focus Ottawa's vaccination efforts on protecting those at risk. Thank you.
Thank you, Kyla. Again, I don't see any hands up, so we'll move to our next delegate, which is Julia Hamer. Good evening, Julia. There you are. So you have 5 minutes, Julia. I'll turn the mic over to you.
Perfect, thank you. Hello, and thank you for hearing me today. Before I begin, I want to address a response made by the board from a previous delegate about policing. It was said that the police services have stated that they will not be stopping people per the provincial order, and that this doesn't happen here in Ottawa. And I would just like to clarify and make it very clear that this does regularly happen here in Ottawa, especially for Black, Indigenous, and people of color. And that this weekend there were many, many reports of people being stopped and interrogated by the Ottawa police, both before and after OPS commented on the provincial order. So I just wanted to clarify that point. But I'm speaking here today because we are at a dire moment in this pandemic, and I believe that more is needed from Ottawa Public Health and Dr. Etches to protect frontline essential workers. The provincial government has shown that they're unwilling to act to save lives and instead are committed to allowing people to suffer grave health consequences. At the same time, we are expecting essential workers to continue to go into risky or unsafe workspaces where there are no mandated sick days or financial supports for individuals. I understand that there is a current supply issue with vaccines. However, AstraZeneca, a vaccine that has been cleared for all people over the age of 18, was just opened up to 40-year-olds. Why was it not prioritized for essential workers? Maintaining an age-based model of vaccination is not good enough. It is not equitable, and it is not demonstrating the value for the people who are continuing to risk their health and lives every day by going to work. My parents were both vaccinated last week, and while I'm extremely grateful for that, they both work from home and have a great capacity to isolate. On the other hand, my partner, who is an early child care worker, goes into work every day to work with many young, unmasked children in close contact. Today, she came home and reported that one of the babies in her care blew their nose into their hands, wiped it on their shirt, and then through their hair. I want to emphasize that this is a normal and age-appropriate behavior, but underlines the risk that childcare staff are exposed to every day. I'm very afraid for her and angry on behalf of her colleagues and all essential workers, including food workers, supply chain workers, transportation and rideshare workers, and essential retail workers, many of whom are racialized and face other forms of marginalization. I also want to reiterate a former delegate in saying that when we talk about childcare workers, we need to understand that that term encompasses both licensed and unlicensed workers and registered and unregistered childcare workers. According to Ontario's Health Protection and Promotion Act, a Chief Medical Officer of Health may act where a risk to health if the Chief Medical Officer of Health is of the opinion that a situation exists anywhere in Ontario that constitutes or may constitute the risk a risk to the health of any persons, he or she may investigate the situation and take such action as he or she considers appropriate to prevent, eliminate, and decrease the risk. Niagara and York regions have chosen to vaccinate their childcare workers. We can too, and we can do even more by extending that to all essential workers. We need to do more to push back against the violent actions of the provincial government. It is not enough to rely on the provincial government to do the right thing, because they will not. It is not enough to continue to push apolitical messages of individual responsibility, enforcement, and patience. It is time, Dr. Etches, to use the powers granted to you as a medical health officer to stand up for the workers who are putting their health at risk every day instead of deferring to the status quo of the provincial government. I echo a previous delegate who says that sometimes doing the right things requires being uncomfortable and exposed. I urge you to radically advocate for the most at-risk members of the Ottawa community and stand up to the violence that is being done by the province and prioritize essential workers for vaccines. Thank you.
Thank you for your presentation tonight. I see no hands up. So our next delegate will be Michelle Arruda. Good evening.
Good afternoon, Chair and members of the board. I want to thank you for the opportunity to speak. I know we are all tired, but this is a huge, huge issue, as we all know. My name is Michelle Arruda. I serve as the Ottawa Area Director for Unifor, Canada's largest union in the private sector. Unifor represents approximately 315,000 workers across the country and nearly 6,000 in the Ottawa region. These include those on the front line of this pandemic, supermarkets, pharmacies, long-term care homes, along with taxi drivers, telecom workers, as well as in factories and many others. I'm here today on behalf of Unifor's National President, Jerry Dias, and our Ontario Regional Director, Noreen Risby. As Ontario struggles to contain the third wave of COVID-19, the issue of vaccinating our essential workers and paid sick leave has become more urgent than ever. What we've learned, it takes a collective effort to combat the virus, and it requires us having the right policy tools for the job. We need to do everything we can to fight COVID-19 and the variant. And the tools we're talking about is to vaccinate essential workers, paid time for vaccines, and as we've discussed in our prior meeting, paid sick days. Workplaces that have been a major source of COVID-19 infections and the lack of paid sick days and vaccination, particularly among essential workers, has direct implications for containing its spread. Allow me to go through just a few quotes from recent days. These frontline workers are seeking priority vaccine access for workers who can't stay home, such as grocery, warehouse, transit, airline, and telecommunication workers, as COVID-19 cases numbers skyrocket with the danger of more contagious variants, said Unifor National President Jerry Dias. Another quote, "The social impact of the pandemic has disproportionately affected workers, exposing across our society. We cannot stand by and allow the vaccine rollout to follow this dangerous precedence," said Lana Payne, Unifor National Secretary Treasurer. One last quote, "Experts across the province have repeatedly called for extraordinary measures that match the severity of the current crisis. Yet as we enter this unprecedented alarming stage in the pandemic, the provincial government continues to ask essential workers to put themselves and their families at risk," said Noreen Risby, Unifor Ontario Regional Director. "This is unconscionable. No worker should be asked to risk their health, their life, for their job. And we need to protect and vaccinate all essential workers." And this is personal to me as well, as I am a home worker, but my husband goes out to work every day, and so does my son, my only child. Essential workers who cannot stay home need vaccination access and paid sick days to protect workers, their families, and their communities from COVID-19. Unifor is calling on provincial governments to expedite vaccination of all frontline workers who must attend their jobs in person. Paid time off, urgently needed, as we know, for workers who need to receive their shots during working hours. All workers deserve the right to paid sick days, again, as we know, both during this pandemic and going forward. one more item I would like to share. Unifor recently commissioned a poll on paid sick leave, which I can share if you would like a copy. I have sent it over to Diane. Part of that report reads, by a margin of more than 4-1, Ontarians support the implementation of paid sick for Ontario workers. 70% support 5 days of paid sick leave, and a slightly lower proportion, 64%, support 10-day of paid sick leave. Fewer than 1 in 5 Ontarians are opposed to paid sick leave. Support is stronger among women, those under 35, and the private sector union members. There is a strong partisan divide, with progressive conservative supporters more divided on this issue and all other party supporters overwhelmingly in favor. Unifor is calling on the federal, provincial governments to legislate 7 personal leave days per year, with 14 paid personal leave days during public health emergency. I would like to take this opportunity in all sincerity to thank all frontline healthcare workers for everything that you're doing and you're continuing to do and what you have to do. Also, I will be taking the vaccine when it's my turn and very excited to do so. Together, we can stop the spread of COVID-19. Thank you for your time, and I look forward to any of your questions.
Thank you, Michelle, for coming out tonight, and thank you for that plug at the end for getting the vaccine when it's available. It's an important message. I see Member Menard has his hand up.
Thanks very much, Chair, and I'll be quick. Thank you so much for being here, Ms. Ruda. Nice to see you. I'm just wondering, when you saw the news, I guess on the weekend, that the province had opened up AstraZeneca for those 40 and above, starting at our pharmacies registration and beginning at Tuesdays tomorrow. What was your reaction to that?
I think it's twofold, and I'm being very honest. I'm one that is now able to get the vaccine, but I'm working from home. I would much rather, honestly, that our membership gets the vaccine, the ones that are working out there. And this is my personal opinion. And obviously, I have a son that's going out every day. I have a husband that's going out every day. So and I know each and every one of us has this in our families. We worry so much. So I would say my position, my personal position would be vaccinate those that are out there first. That only makes sense to me.
Okay, thank you for that.
Thank you, Member Menard. I see no further questions. Our next delegate is Aaron Surratt. I hope I got that right, Aaron.
Yep, you did.
And you have 5 minutes. Thank you very much.
Good evening, everyone. So I'm going to be repeating a lot of what you've heard tonight, but I'm going to do so because I hope it will only further motivate you to take action on these important issues. We are in a severe health crisis that was entirely avoidable. On February 1st, modeling presented to the provincial government signaled the trouble to come. And then on April 1st, projections showed a new stay-at-home order would be crucial to getting the increasingly devastating third wave under control. Despite that recommendation and a letter from 153 ICU doctors imploring the province to take tougher action, Ontario waited nearly another week to issue the order. And then came the most recent announcement last Friday, which we rightfully expected would finally put the necessary measures in place to stop the spread of COVID, particularly in workplaces where most people are contracting the virus. And instead, Ford shut down playgrounds and parks and gave the police more power. And I, like so many people in this province, am furious, and we should all be furious. The provincial government has demonstrated a lack of policy based on science and the advice of medical and public health experts. For example, the designation of Canada as one of the COVID hotspots for vaccine prioritization. The data shows that the K2V postal code has the lowest hospitalization and death rate among the 114 designated hotspots. At just 0.35 per thousand. That's lower than the rate in some 300 postal code zones not designated as hotspots. So I'm afraid that I don't share the feeling of hope expressed by you, Mr. Chair, in your verbal update at the beginning of this meeting. Doctors and nurses are calling the situation in our hospitals a war zone. According to the scientific director of the group of experts advising the province, Dr. Peter Juni, he says right now in Ontario, the pandemic is completely out of control. And most people, as I mentioned, are contracting COVID at work. These are workers we repeatedly praised as essential, but instead of protecting them, we continue to put them in the line of fire. Doctors are speaking out because younger people are now contracting COVID and becoming more severely ill given the spread of variants. As one doctor said on Twitter this week, we have looked these workers in the eye and said, your labor is essential, but your lives are not. So what does this say about our priorities and values as a society? Contrary to the repeated recommendation of the Science Advisory Table, Premier Doug Ford has not brought in paid sick days. The Science Advisory Table also called for doubling down on vaccinations in the highest risk communities, limiting which businesses are allowed to stay open, and making essential workplaces safer. And I do want to recognize that the board wrote to the provincial government to call for paid sick days. And we learned this evening that OPH is calling on the provincial government to address limiting which businesses are allowed to stay open and increasing monitoring and enforcement in workplaces, which is also encouraging. But I'm now pleading with you, Dr. Etches, to use the power you hold to make changes to Ottawa's vaccine strategy so that it is based on where the virus is spreading. I recognize that vaccination alone will not get us out of this crisis. Only proper measures to stop the spread in workplaces along with these measures will, and in particular paid sick days. But where it is possible to implement the policy measures that will better address this crisis, you have a duty to act. I will be 40 at the end of this year, and so I just registered today to get the AstraZeneca vaccine. But I live alone, I work from home, and I have no contact with anyone who is at risk of becoming seriously ill or dying from COVID. I should not be prioritized at this time for the vaccine. Health officials need to explain to people expecting to receive their immunizations on the age-based timeline unveiled earlier this year that we don't have enough vaccine to go around, and in the best interest of all people in Ottawa, frontline workers and those living in high-risk communities are the people that are going to get the vaccine now. You have the power to make changes to the vaccination strategy, and I'm begging you to do so. Thank you.
Thank you for coming out. I see no hands up. We'll move to our next delegate, which is Carrie Lee Boyd. Good evening, Carrie, and you have 5 minutes.
The speaker is muted, Mr. Chair.
You're muted, Carrie. We can't hear you.
Sorry.
That's fine. We'll just back the clock up. Not a problem.
Okay. I would like to sincerely thank you for the opportunity to discuss my thoughts regarding not only the importance, but the significance of prioritizing the vaccinations for all early childhood educators. Childhood educators were amongst the first group of people called back to work since the nation shut down completely in March of 2020. It was emphasized not only as a short couple of weeks that childcare must be deemed as essential and that our healthcare and emergency response systems rely on it. As licensed childcare agencies began to reopen, we educators implemented every possible health recommendation in order to make our environments as safe as possible. This included vigorous daily screenings, wellness checks, wearing PPE, enhanced cleaning and sanitation measures, reorganizing our learning spaces, and creating multiple procedures and policies, just to name a few. While we were reopening, we were also scared. Scared because as educators, we were told we must return to work, that we must show up and help keep the healthcare system and workforce alive. That people were struggling to maintain a work and life balance, and that was on our shoulders to fix and to be present for. We were scared because we were getting ready to open, knowing that our own families, vulnerable parents, grandparents, and our own health issues. Nonetheless, we reopened because we are essential. I believe it is crucial to differentiate between childcare workers and teachers, not because we are more essential than they are, but rather for the vast majority of this pandemic, they have been able to switch their services to completely remote learning. School teachers, when in person, are able to maintain safe distance, are comforted that children are masked, and they have less work time on the floor. They have children that are capable of understanding the rules and the importance behind them. As things have changed in wave 1, 2, and 3, the risks to childcare workers have become more and more dangerous. Consider, we are in the opposite position of school teachers. We work every day with children unable to wear masks. We work every day with children unable to social distance themselves. We work every day with children needing close contact through diaper changes, consoling tantrums, and triumphs. We work every day without a summer vacation or wage break because we are essential. To our own families, to the families of children we serve, and to the families and to ourselves, we show up every day and give this our 100%. We are not on the priority list of essential workers to be vaccinated. When will this province show up for us education workers? When will we be prioritized like we have had to do so to prioritize for our province's workforce? My personal story is that I'm a single mother by choice, caring for a stage 4 chemo patient. I am terrified. I've been exposed to COVID, and that feeling of fear has really affected myself and the other staff I work with, mentally and physically. The thoughts that go through our minds: when will it happen? When will it be us? Will this be a severe case? This is just to name a few. Could I ask that if anyone on this call would be interested to come and eat your lunch with my class of 16 3-year-olds? To clarify, none wear masks. They sit within an arm reach. They don't have the best table manners. And before COVID, this was a cherished moment of my day. But somehow, in this high anxiety moment, it is underlined with stress and the fear of being exposed. Like all of my colleagues, I absolutely love my career. It is my calling. We take care of children, keep them safe, support their individual learning through play-based curriculum, and build vulnerable partnerships with families. And although we've always known, the world knows now how essential we really are. The other side of this career is the staff shortages, long hours, being underpaid, and often being substandard benefit, and often having substandard benefits, and now being underappreciated and, quite frankly, overlooked. By vaccinating childcare workers, it means we can continue to make our learning environments as safe as possible, which is what we have always been there to do. We currently are open while everything remains closed. We have been told we are essential. Now, please, can we act like we are essential? Please prioritize the vaccination for all childcare workers. I really thank you for your time.
Thank you. I don't see any questions, however. So we'll move to our next delegate, which is my colleague on council, Councillor McKinney. And I'm sure you know the rules. So we'll turn it over to you for 5 minutes.
Thank you, Chair, and good evening to board members. Some of you I sat beside last term. Suzanne, it's nice to see you. Nice to see you all. And thank you for allowing me to join you this evening. And thank you to Dr. Etches, of course, for your update. It certainly does provide some of the reassurance that residents in the city need after Friday's disastrous announcement of half measures that will do little, if anything, to stem the tide of the third wave of this pandemic. I felt compelled to appear at today's meeting because of the sheer volume of messages I'm receiving as a city councillor in response to the priority vaccine rollout. It's clear, obviously, from the delegates that appeared before me and the hundreds of messages that I'm receiving, that it is time for what Councillor Menard has coined a made in Ottawa approach. And while we don't necessarily have the immediate power to roll back some of the very misguided measures announced on Friday with respect to workplaces and restricting outdoors to people. We do have a responsibility as a city and you as a Board of Health to ensure that we continue to protect the most at-risk and vulnerable residents in our city with the vaccine that is available to us today. So with that, I believe that we must shift our approach today from what has been a successful age-based approach. But now for anyone under 50, that's got to shift to one of risk. We must vaccinate teachers, childcare, ECE workers, our transit workers, grocery store clerks, anyone who must leave their homes to work in public settings. We cannot vaccinate, and we know that. We cannot vaccinate our way out of this devastating third wave, but we can apply an equity lens to our approach that ensures that we're keeping the rate of infection in our city as low as possible. And you've heard tonight that people are frightened. Having paid sick leave for workers to stay at home when they are sick would have kept our transmission rate low. But the current provincial government continues to deny this one measure that would actually make a difference across the province. However, we know, we have the evidence that some 75% of community outbreaks in this city are connected in some way to workplaces, and they are mostly in the service sector. And it is in your control, Board of Health, to reprioritize the vaccine rollout for hard-hit communities and residents who have to go to work every day and are at the greatest risk of both infection and transmission. I think it's telling that just today, the CEO of the Queensway Carleton Hospital put out a message saying that 50% of COVID admissions that they are seeing in the Queensway Carleton Hospital are people of color. 50%. This means that our low-income residents working in precarious and service sector employment are disproportionately affected. I'll end with this. I live in Centretown West. We are a high priority neighborhood, but we're a high priority neighborhood because we have a large number of rooming houses. Take those rooming houses out, the rest of us are healthy, mostly wealthy, and we are protected and we stay at home. We're government workers. We are not at near the risk of others. But the 30-year-old childcare worker is at risk. And when that worker decides that she's not willing to risk her health and stop showing up for work, we will all quickly learn the definition of essential. Because once childcare workers, and that's who we've heard from tonight, once they stop showing up, other essential workers whose children they care for, nurses, grocery store clerks, they can't go to work. And that is when we will really learn what essential means. So I ask you to please consider prioritization of essential workers now, rather than continuing to move through the age categories below 50 years of age. At the very least, we need a registration system to ensure that we are at least capturing the data that we need to ensure that these essential workers, people who need to go to work every day, have all the information that they need to sign up as soon as they are eligible. We just can't leave people out there waiting. What happened on Friday, I believe, traumatized our population. What happened on Friday with the provincial government left us all with no rudder. You, the Board of Health, can provide that rudder. I believe that. I think that
Councillor, you're over your 5 minutes.
Can.
Thank you to wrap up, please. Thank you.
I believe that we can show essential workers that we actually understand the risks that they are under for infection and transmission. Thank you.
I see Member Menard has his hand up to ask a question.
Yes, thank you, Chair. Thanks for being here, Councillor. I think you've captured it. I think you've captured the essence of what people across the city are calling for now. And certainly the call around the registration and the process that'll come up that's an important piece of all of this and how people understand how the timeline and when they can do that. So I think that's a big piece of all of this. One question I have for you is, and it's somewhat unrelated, but the motion that's been tabled today, I don't know if you've had a chance to look at the motion that's been tabled so far and what your views are of that motion.
Well, I've only had a quick look at it, of course. It just came up this evening, but asking the Premier of Ontario, who people no longer trust, to complete a review of businesses and services, I think really is almost closing the door after the horse has gotten out. I don't trust the Premier of this province, and nor do most people, to conduct this review. But also, I believe that, at least in Ottawa, for the most part, our workforce can stay at home. We do not have the same workforce that Toronto and Peel have. We don't have those large manufacturing centers. We don't have those large distribution centers. So for Ottawa, I believe that the people going to work today need to go to work today. So perhaps if the Premier did the right thing and closed the businesses that aren't essential, but what is not essential? Somebody who is working to fix elevators in a seniors building, working 2 or 3 in a shack, are they essential? Well, if a senior is living on the 21st floor, they're essential. Somebody who's going into buildings, into apartments on behalf of Ottawa Community Housing to look at fire code, to fix doors, are they essential? They are essential. So we have workers who have no choice in this city for the most part to go into work. So I think, the motion for the most part won't make much of a difference if this Premier were to do the right thing, which most of us don't trust anymore. This motion wouldn't make much of a difference, I don't believe, it in the city with our workforce.
Thank you very much.
Thank you.
No further questions, so thank you, Councillor. Our next delegate is Nathan Pryor. And Nathan, are you still with us?
Nathan has left the call, Chair. He's taken his name off the list. The next
He's
speaker
taken the name
is
off the list. Okay. So our last delegate then is Greg McDougall. I see Greg's here with us on the phone. Evening, Greg. Greg, can you hear us?
He may not know he's muted, Mr. Chair.
Good point. Greg, you're muted. If that, can you hear us?
I wonder if the administrator can take him off mute, Chair.
I think we're having a bit of a technical glitch trying to figure out how to unmute someone who's on the phone is what's going on right now.
I'm not able to unmute him. He needs to unmute himself.
Alternatively, he just needs an instruction to press *6.
So I'm not sure how we're going to get through to Mr. McDougall.
He could hear us, *6 or.
Yeah, yeah. If you heard that, Greg, if you could press *6. So I think we're just going to have to proceed.
Are you
oh, there
able
you
to
are.
hear me
Okay,
now?
Greg.
Okay.
There you go.
Yeah.
Excellent.
Thank you.
You have 5 minutes, Greg.
Yeah, I was pressing that a lot, but it wasn't working. Yeah, so thank you for the opportunity. I would, as some others have, like to acknowledge we're on unceded territory of the Algonquin-Anishinaabe, and specifically today, with all the border policing, to note that the Ottawa River was, or the Kitchissippi was always the center of the territory, not the border. I have 3 points today. One, supporting the calls to vaccinate essential workers. The other one, to talk about safe working conditions and the April 28th National Day of Mourning. And the third is to talk about misrepresentation of the Ottawa Public Health data on schools in the report and in media statements. So the first part, I do support, and I just want to say personally, I'm over 40. I can get a vaccine through my doctor as of tomorrow, apparently. But I go to grocery stores where there's retail workers who are young, who interact with, say, hundreds of people a day, and they're not going to be able to get that. And I'm in a low-risk neighborhood and low-risk activities, so that doesn't make any sense to me. And I hear all the stories of childcare. And so I would urge Dr. Etches and the public health to make a different decision than what they've done and actually prioritize essential workers immediately. Part two, so this is also safe working conditions. It includes having whatever safety measures there are. There's been on this call details about being inundated with workplaces having outbreaks, half of workplaces not following safety guidelines. Councillor Menard saying 75% of outbreaks are from workplaces. So yeah, so I don't know how many people know about it, but on April 28th, it's the National Day of Mourning. This has been celebrated in Canada since 1984. And it was originated in Canada. It's now in over 100 countries, and it's to honor workers killed or injured on the job. So sometimes flags are at half-mast, people do ceremonies. I urge public health to make a declaration for April 28th to honor all the workers, and especially racialized and other marginalized workers that are in kind of like the second tier of working class conditions. To make a declaration, and also there's an idea that at 10 a.m. on April 28th, to take a 10-minute break for all workers who can safely do so, and for all the population to honor that. And I think it's better than the moment of silence that we had today, or there was a religious ceremony that was mentioned earlier to honor the dead. I think that we need to honor the workers who have been killed and injured through long COVID. Yeah, so that's another proposal. The third thing, how much time do I have left?
Sorry?
2 minutes.
2 minutes, yes.
Okay, cool. So there was, Dr. Etches has been in the media very recently saying there's almost all the cases in schools were caught in the community. And the February public health report, said that 85% of the cases in schools were caught in the community. So just a bit of a breakdown. I have a math degree. I used to be a teacher. The report did find 15% of the cases in schools were caught in schools. But of the 85%, they didn't give a breakdown of where all those cases came from. Like they didn't say, but of the subgroup, they said 63 cases they looked into. Only 29 of them they could trace to a case in the community. So 29 out of 63 is less than half. So if that continued for all 800 and some cases that were in the schools, you're only able to say that half, or less than half, came from the community. So you're saying 85% did. And another very interesting thing was that the number of outbreaks in schools was going up until the start of October, then it started going down. And the thing that the report even notes is that that's when the testing guidelines changed, and less than half as many under 20 got tested every week at the start of October. So the outbreaks went down because the testing went down, not because schools got safer. There's lots of evidence that schools are a major contributor. Youth are a major contributor. Youth, there's the SAGE study from the UK published December 31st, found that under 18, 12 to 18-year-olds or 12 to 17-year-olds are 7 times more likely than older people to be the first case bringing it into a household. So, and there's so much evidence, and I don't know how this report has been represented as saying there's so little transmission in schools. I think that's something that is, I mean, irresponsible is a good word for it. So that's what I have to say. I would again like to push the day of mourning for April 28th. That is something like special. Thank you.
Thank you, Greg. I don't see any hands up, but there is. I can say there is an event on the 28th, sponsored by the Ottawa and District Labour Council. I think to recognize the day of mourning. I think most councillors are aware of it, but board members may not be. So I will see through the board secretary that information is shared with you. if you want to participate. It's obviously a virtual ceremony, but I can see that that's shared with all the board members. So thank you, Greg, for bringing that up.
Thank you.
So that is the last of our delegations. We have a motion in front of us, and we have the ability to also ask Dr. Etches and staff questions. Before we go there, I'd like to propose a direction after we've heard from these delegates to Dr. Etches for her consideration. And it's short. I'll have the board secretary put it up on screen so people from at home can see it. But it says that the medical officer of health take all the concerns raised by delegations and through written submissions and share these with the Ottawa Vaccine Sequencing Task Force for their consideration as they undertake the work of sequencing essential workers who cannot work from home, which includes childcare workers, education staff, and others, in advance of moving to that phase of the local vaccine rollout. Is that a direction that you can accept, Dr. Etches? I can't see.
Yes,
Dr.
yes, Chair.
Okay.
I can absolutely accept this direction. And I do wonder if it's worth me making any comments based on what has been said as well. I'm happy to.
I think that might be a good start to the questions. You can tell us what you have heard and how you interpret it, and thank you for accepting that direction and making it part of the discussion as we figure out the sequencing going forward. So I'll turn it over to you, Dr. Etches, to make some comments on what you've heard today, and then we'll move to the board members for questions.
Thank you, and I can see everybody better if we aren't projecting the screen at the same time. Sorry. I think the idea of sharing what has been heard is really important, because we did hear some very useful information tonight, and I'm very grateful for the board taking the time and Chair for you adapting to be able to make this possible. I think the concerns definitely resonate in terms of what the experience of childcare workers and essential workers is, and there were people speaking to their experience that we can't fully appreciate, not coming from a lower income racialized community, for example, and so their voices being brought to the table of the sequencing task force is important. And I would like to reassure people that we have deliberately chosen to make sure that low income and racialized and newcomer and Indigenous and Black people of our community are on the sequencing task force. So there will also be that lens there. The things that I heard also very useful, to specifically convey, of course, were around some of the nuances in the language related to essential workers and the importance of specifically naming different types of work like early childhood education, home-based childcare, nannies, cooks, etc. And I think that our experience has been in the healthcare world, when we vaccinated healthcare workers, that we were inclusive. We took a broad view of who is a healthcare worker in a healthcare setting. And I would imagine, following that kind of precedent, that there would be an inclusive view of who is a childcare worker, for example, or working in an essential workplace. There were some common questions heard. I definitely heard around this moving childhood workers ahead was done, or education workers is done in Niagara, why not here? I think I was hoping to convey in my verbal update the real importance of getting through the older adults to save lives. And I know some of our speakers spoke to people being less at risk if they're older because they can stay home, but COVID is finding older adults. It is reaching people, and then you know that likelihood of death is just so much greater, like over 200 times. So that is an evidence-based approach where we're keeping the older adults in mind. And I don't believe in Niagara they meant to displace people in their 60s. With education workers. That wasn't intended, but things rolled along and moved faster. And so there was some disruption in access to vaccine for people in their 60s because of the move there. However, I think you can see we're reaching that period now where we have the option to pivot and use the vaccine for more essential workers. And I think the other thing I hope comes through is that essential workers have been an important group throughout, and we are reaching people through neighborhood-based approaches where we're really concerned, not just about a particular workplace where someone is working or a particular type of essential worker, but the populations that are more disadvantaged and at higher risk. So we will continue to grow that. As well as looking at workplaces. So the other things that I think were sometimes mentioned was the desire for data. The desire for data to judge, are we achieving more equity in the vaccination of populations that are less disadvantaged? And I want to tell you that we are not seeing the picture of inequity that has existed in other places in the province when you compare postal codes from lower income areas and higher income areas. Typically, an health outcome, you might see usually better outcome for higher income neighborhoods, and all the way down less and less of a better outcome to the lowest income neighborhoods where you have the poorest outcomes. In Ottawa, we have avoided a gradient of vaccine coverage across the high income to the low income because of the outreach we have been doing to neighborhoods with less advantage, because we started with people over 80 in the postal codes with higher rates and less advantage. And that is what we need to focus on. The people who spoke tonight about needing to be deliberate are absolutely correct. If we do not deliberately try to promote equity, inequity results. Because of the mass clinics and the booking systems and the barriers, we cannot rely on a mass approach to promote equity. We have to be targeted, and that is what the team knows. That's what they've been working on, and we will continue to do. And pharmacies are out of our control, but we can use the AstraZeneca and the primary care partners that we work with, again, to reinforce that we want to focus now. We're moving to people who cannot work from home. So I think we'll continue to evaluate equity as one of the outcome measures. So maybe that's enough. I see some questions. Probably I can speak to some other points, basically of most interest to you.
So thank you, Dr. Etches. One thing I should have pointed out, which is again is a little unusual for a Board of Health meeting, but we have had both Tony DeMonte, head of emergency services, and also Chief Slowly volunteered to be here tonight as well to answer any questions board members might have around their respective roles in the response to COVID. So I want to thank both gentlemen for being with us here tonight and make themselves available to answer questions. I see some people with their hands up, but we're gonna go as Deanna gives me lists and flips it from alphabetical forward and alphabetical reverse. So I like to follow what Deanna advises me to do. So we're gonna start in reverse order. And if you don't have any questions, just indicate so and move on to the next. But first on the list in reverse order is Member Tilley, if he has any questions for any of the panelists.
Well, thank you, Chair Eglai, for steering very well through certainly an agenda of a lot of speakers, all who seem to raise some very valid points. So it was great to hear from everyone reminding us of the value of the work, especially of the childcare workers, but also the other front end workers who are out there every day in the face of risk. First of all, I just wanted to congratulate Dr. Etches and the team again at Ottawa Public Health for, we talk always about learning to coexist or exist with COVID. When I went through this board package to see the 2020 annual report, to see the update on the 5 pillars of the strategic plan, to see the way we're tackling to deal with the challenges of the increases in mental health issues and substance use issues by working with other partners like the Royal and CHEO and YSB, and even doing the virtual piece. So it was great to see that piece. And I just wanted to congratulate the team at Ottawa Public Health and yourself in the face of everything else that's happening now to have that update to see. So my only question then, after hearing all of this, and I think you've touched on it a bit, Dr. Etches, but of course our former colleague on the board, Councillor McKenney, raised a good point. Certainly I understand the evidence-based decisions that were made in the strategic prioritization to look after the vulnerable older population, and your numbers were startling on the risk of death, of dying that's with that older demographic. So Councillor McKenney had talked about, as we move down into the 40s now, the trying to shift our focus to vaccinate those who are at risk rather than making it to shift from age-based to those at risk. Do we even have the capacity to do something like that, to monitor and implement something like that when we're talking about thousands of vaccines per day, where we could then differentiate between the different groups? I understand the importance of doing that, especially when we look at some of the OC transport drivers and other groups like that. Do we have the capacity to move from age-based to risk-based once we get into the 40s, for instance, or would we just have to keep going into doing it age-based?
This is a plan that's under development. So Mr. DeMonte may want to add to my question or response to your question, but the idea is, if the groups are smaller group of childcare workers or specific pieces, we may be able to use a pre-registration system and then look at a back-end solution to bring people through our mass clinics. We may be able to focus on the neighborhood-based places as ways to also reach people. But the actual number of vaccines that we have will not allow us to do all of the essential workers at once. So we do need to employ a system that somehow prioritizes, and this is what the vaccine sequencing task force will be determining. What is the appropriate way to bring people in to access the vaccine supply that we have? We know the neighborhood-based clinics do not rely on the provincial booking system. And so we have some other options there where we can bring people forward. And again, we're looking to the lowest barrier approaches there.
Mr. DeMonte, is there anything you'd like to add to that before Member Tilley goes to his next question?
Thank you, Chair. I think Dr. Etches has described it well, and I would say that the simple answer is yes. The team is pivoting and has been quite dynamic in their approaches to target other populations previously, and so we're looking at that. I think the one element, and I think it's good for the rest of the debate. The challenge of vaccine supply continues to haunt us. And continues to be a big factor in good planning, good targeting, and helping our operations move forward. In spite of being able to date to have given over almost 270,000 doses, and targeting, as Dr. Etches said, the high-risk populations by age, and then we've moved down, and we really are at a moment now. 65 and older is 180,000 of those individuals, and we've given over 270,000 doses. So we're at that point where we can now pivot and look at, and our strategy must change, and that's what we're doing. And I want to reiterate, and Dr. Etches did it in her preamble, in her verbal report. We've been doing this since the beginning. her team and what we've done is those high-risk populations and those high-risk neighborhoods, we've been in that even before the provincial system was up and running. So it's been something that's been on our mind since the beginning and has been working really well. And we've had two big major strategies: target those high-risk populations, and at the beginning, the age factor, but also get lots of volume through the mass clinics. Now we're going to pivot the mass clinics and make them more tactically specific to certain groups. So we think we can do that, but I remind people, vaccine is limited. Everything is booked now until April 30th. And we had a plan from April 20th to May 11th. We were expecting 120,000 doses. And now we're being advised we're going to get in the neighborhood of only 95,000 doses. So a big difference. And that also is going to impact where we can go. So it's going to be even more critical that we follow Dr. Etches and the team that's looking at that, where they want to go. And that's why we're pivoting our operations to target and be more surgical in our approach.
Well, congratulations to you, Anthony, and your team. I hope people appreciate the logistical piece that's required to pull this off, and to you, Dr. Etches, and to you all, I guess, Chair Eglai, as now we reach out. I like this idea of trying to push back to Queen's Park on our Ottawa-based solutions as we move forward, trying to figure out how to get this under control and what the priorities are. So wish you the best there. That's it for me.
Thank you. Member Pinnell, please.
I don't have a question at this moment, but I really would like to thank Dr. Etches for your presentation and answering all the questions. Merci. And also, I'd like to thank the very caring delegates this evening for their presentation.
Thank you very much. Our next is Member Menard.
Thanks very much, Chair. And yes, I agree with Madame Pinel. The delegations tonight were fantastic, just well-versed, and I think on point, and expressing the feelings that so many people are having in Ottawa about this pandemic and how difficult it's been on so many people, so many sectors, but particularly our essential workers that are delivering for us every single day. So just huge thank you to them, and I'm glad we gave an opportunity for people to speak about this. I think the most important thing was listening to that, and how we react now will be critical. And so I do have some questions. I think the first one was around one of the delegations who raised that we don't need some powers to do some of the things we're asking for in the motion that's been tabled on the non-essential businesses side, and that we possess the ability to do this through a section 22. So I'm just wondering if staff can respond to that, what their view is of that, and can we use that power to start enacting the things that we're saying the province should be doing?
So I don't know, Dr. Etches, if you want to start with that, or if you want to pull in Omar to speak to the legislation, or how you want to proceed, but I'll leave it in your hands.
Sure. So we are always, myself and Ottawa Public Health, and yes, with legal advice, but we're always asking ourselves what else can be done to limit the places where people are coming into contact and support people to, have what they need to decrease transmission. And at this point, you could hear from my reports, we're seeing some transmission in places that don't appear to be essential workplaces. But we also heard the questions from Councillor McKenney. What are essential workplaces? It's very hard to define. The province had a narrower list back in March of 2020 than they do now. And there are ways probably to tighten that up even further compared to last March. So I don't feel that's my area of expertise to determine what is essential and what is not essential. How I also would say was said before in terms of the authority of the provincial government, is they're the ones that have defined what is essential, and it's much harder, and maybe this is where Omar wants to speak in, for a local jurisdiction to enact something that is counter to provincial legislation. We also know that the enforcement strategy that comes along with provincial regulation is stronger than what could be accomplished. It's more effective in terms of the processes of trying to follow up and use a tool that's for public health purposes, not to look at addressing business operations. So Omar, is there anything you would like to add? And I would say we're going to continue to look at what we can do locally if the province isn't acting.
Yes, I just, through the chair, just echo what the medical officer of health has said, and note that Section 22 of the Health Protection and Promotion Act, it appears as though it's very wide open. The medical officer of health can require a person to take or refrain from taking any action. But that said, as the medical officer of health mentioned, there's other legal issues, jurisdictional issues, and every case has to be reviewed on a case-by-case basis. So although it may seem like a provision that's very broad and applicable, in the end, there has to be an analysis that takes place, and often it's the province that's best placed to take action.
Thank you, Omar. Omar, maybe you could, for those at home who aren't as familiar with the Board of Health, maybe you could explain what your role is with OPH, Omar.
Yes, I'm legal counsel with the City of Ottawa. I advise the medical officer of health and other staff with respect to legal issues with the health unit, including communicable disease orders and all manner of issues.
Thank you. Just for those at home who may not be aware of the role that you play. Sorry, Member Menard, you had another question.
Yeah, I have a few questions. Thank you for that. So I did hear that if the province is not going to enact some of these pieces, we may go back and say we're going to be looking more into this and potentially taking that on ourselves to mitigate. If we're seeing transmission happening, we will take more action depending on their response. So I appreciated hearing that, Dr. Etches. With regard to the provincial change to 40 plus and AstraZeneca available at our pharmacies, it's just so confusing. And we've kind of talked about this offline, but what is it? It doesn't seem like they're following their own orders, their own phasing, phase 1, phase 2, phase 3. That I understood that those 40 plus was not going to be until phase 3. And here we have it in phase 2. So do you anticipate this is going to continue to happen, that they will again lower the age if there's availability before, say, some of the other target priority groups that we have in phase 2 that were supposed to be in phase 2, but advanced phase 3 down to, say, 30-year-olds and up? What is the anticipation of what the province may do?
I can't really predict really different aspects of this program in terms of what the province will do. What I can do is provide my best advice to the province about what is needed as we continue this vaccination program. And so I will continue to work with the province to indicate, we needed to protect older adults. And once we protect older adults, we need to continue with the other priority groups they mentioned, people with very high risk health conditions and people who live in congregate settings. We agree on these things. We need to continue. People who are also in neighborhoods with higher rates and start on across the essential worker categories, looking at all age groups. And so that is, of course, the opening up of the age groups is so related to vaccine supply. And I think that what we know is there are going to be multiple channels. And so we're trying to make the most of them. So I would say for people who cannot work from home, I'm going to do all I can to direct primary care where they have vaccine for people over 40, that they promote it for people with the highest risk health conditions. And people who cannot work from home. And I will provide feedback to the province that the pharmacy channel is a more blunt tool in that regard. And I will inquire about their plans for the future, but I can't really predict at this point.
Yeah, that's great, because I think you got to think we could have started vaccinating a lot of these essential workers or frontline workers that we heard from today, instead of what's been allocated. So I think a mistake on the province's part. In terms of independent or unlicensed childcare providers, we heard from some delegations about that. Was that part of the original phase 2, or would that have to be something that we add as a category, those 8 categories in the essential workers, people who can't work from home?
The actual language in the provincial guidance document is individuals working in childcare as follows. All licensees, employees, and students on an educational placement who interact directly with children in licensed childcare centers and in authorized recreation and skill building programs, and licensed home childcare and in-home service providers, employees of a home childcare agency, and students on an educational placement. So I do think this is a fairly broad language, and the sequencing task force has set precedents with an inclusive approach. So I don't think there's any further need to, we're sending along the comments from the delegates, and I think that they will understand that issue.
Okay, that's very good news to hear. I'm wondering what the plan is in the next little while to potentially get a newsletter out or something to every household in Ottawa that will indicate some of the plan going forward. We're at a kind of point where we've got 270,000 vaccinations out the door, more about to come. We're kind of getting at a critical point where hopefully we have critical mass and we have a larger amount of vaccines in the next month and a half. So I'm wondering if it would be worthwhile, if there is a plan, or if we can create a plan to send something out, a leaflet or something to every home to fill them in on this information. Of course, we all do our best to get information out, but in order to help push forward vaccinations that are necessary and maybe dispel some myths that are out there, is that worthwhile? Is that something we're considering?
Mr. DeMonte may want to speak to this. There would be very much a real challenge with a mail out that was too specific. As you can see, we didn't know about the change to the 40+ through pharmacies, so our description of the channels would be imperfect, potentially, like quite possibly things shift by the time it's printed and it's in the mailbox. However, there would be value. I know the team has been thinking about at least pointing to people to our website, which is constantly updated. And I would encourage anybody who's listening to sign up for a proactive feed of the updates to our website, because you can do that. You can get a regular update about any changes to vaccine availability. Mr. DeMonte?
Yeah, Chair, I would reiterate that it's been, and I think you all observed it, moment by moment changes have happened, and that technique of communications is one that needs the longest time frame. You got to prepare things, you got to deliver them, and by then things have changed. To be candid, Dr. Etches and I, before we give briefings to council, sometimes the morning of, we're getting changes and we're adjusting our messaging. But so we'll continue to do that. We'll continue to have the documentation and the memos that we send to you. That's the most up to date, and we can react quickly. But yeah, I think that would be challenging, and I would echo Dr. Etches. I know where the member wants to go, Chair, but that is it would be difficult, because by the time we get the messaging together, get it translated, print it, send it out to households, we could have had several changes from there. So that's just the reality of what's been going on. If that stabilizes, maybe it can be a tool later on as we get further in the summer and things start, being clearer. That could be another tool, but we'll continue to give you any communication by the best methods that we can.
Okay, that's helpful. I would suggest, if that's not possible, that perhaps a broadcast voice message that would help to get it to every phone in Ottawa. That I think is also a cost-effective potential, and it's pretty instantaneous, and the messaging should be, compact. So if we can't do a mail out, then I think broadcast voice message would be important as an alternative. Just a couple more really quick ones here, Chair. I guess in terms of timeline for the frontline workers that we're talking about, childcare, education workers, I'm hearing May is essentially what we're trying to target. Is that this Ottawa approach for switch for May will start to occur then. Can you maybe give us? I know you can't give firm dates, but just confirmation that is the plan. That is what we want to do. We want to make this pivot and this shift as soon as we can, and what more information people may have in terms of how they'll go about it. If you're an unlicensed childcare worker, do you have to go through the provincial booking system to get online and do that, or are we going to go direct to OPH clinics with some other documentation?
Chair, maybe I'll start, and if Dr. Etches wants to add, those are excellent questions. So that's what the team is doing right now. I can tell you, so as you know, up until April 30th, our complete system now is fully booked. So there, every vaccine is accounted for and booked. And as a matter of fact, we've got a bit of a challenge. The confirmed vaccine that we have, there's a Delta right now that the province has pulled back, say we won't get it even though it was confirmed. So we're scrambling to ensure, as we've always done, that nobody that has an appointment won't show up without a vaccine. So we're going to solve that problem. That's the first problem we're solving. So after that date, yes, we're pivoting then based on the vaccine we have, that next group. So there was a second part to your question there that's important. We're attempting to work with the province. The model that would be very useful is if it could be on the provincial booking system, and there would be a way that someone could call as an essential worker or one that's required, they could book on the provincial booking system, because that gives us the advantage of the mass vaccination site. So we could actually specialize a mass vaccination site for certain workers, or have a category or a percentage. We're just doing that work now. We don't know if that's going to happen. So we've got a plan B and a plan C. A plan B is we're looking at, can we have a registry of people and then upload that ourselves into the provincial system? Or is there a possibility, although this one becomes more problematic because of the numbers that we start getting into as far as volume, our public health line could take that. Because as you know, we've been doing our pop-up clinics separate from the provincial, so we could surgically target our neighborhoods. Would that be a challenge? So that's what we're working on. So the simple answer to your question is, after the 30th, as we go forward with whatever vaccine we have, we're going to attempt to start with those groups right away and find ways. And I know Dr. Etches will tell you, I would encourage those right now that are 40 and above, they can go to a pharmacy, and that's another option for them as well too. And so that's something else, multiple strategies, physicians, the pharmacies, and then the tools that will come up, and we'll have to communicate that clearly. So that's coming as well.
Okay, thank you for that. And my last question is to Chief Slowly. I have two basic questions. Wondering how the first day of the provincial border checkpoint piece went today. I was seeing lots of media about that. And also on the second portion is that you've been given some broad new powers that I think people are concerned about in terms of overreach for residents, particularly Black, Indigenous residents, Muslim residents. And so I'm wondering, are you utilizing those powers now, and how are you approaching those new powers that you've been given?
Thank you, Councillor. I think Dr. Etches referenced it in her earlier comments, so I'll just reinforce at this point, we have not been utilizing any of the new powers. We've been working very closely with Dr. Etches and her team, Tony Monte and his team, other city leaders, to make sure that we're getting accurate risk assessments, as been expressed already during this call, and adjusting our operations in coordination with our public health and other partners here. We've not seen any need to utilize the new powers. We've been very explicit from the very onset as to when the powers were announced, both in the first iterations on Friday and then the later iterations in the late evening on Saturday, that before we would apply any of those powers, we would see what extent they'd be done so ethically, equitably, and with any real effectiveness. And again, we've always taken that assessment based on the overall health assessment and the desired health outcomes. None of that has changed since the announcements that came out late in the week on Friday and through to today. In regards to the operations at the border, while we have established border checkpoints, we are committed to reevaluating on a daily basis. In fact, right now I should be with my command team as they evaluate the first full day of operations that's going on. There will likely be some changes based on the experience of both the frontline members involved in this, transportation, OC Transpo, feedback, the experience of commuters, as well as our partners on the other side of the provincial border, as well as the OPP and other municipal agencies who themselves are involved in border operations. We'll calibrate as best we can after the first full day, make adjustments in real time going into tomorrow. There may be some announcements that come out later tonight or early tomorrow morning around any changes. Our commitment again with the border is to make sure that it contributes meaningfully to health outcomes and nothing else in that. Part of our review will include updating Dr. Etches and her team and getting any further feedback that she or her team may provide, again, on the efficacy, effectiveness of operations and outcomes. Hopefully that answers your questions, Councillor.
Thank you very much, Chief. I appreciate that.
Thank you very much,
Thank
Chief.
you, Chair and Dr. Etches, for working on that direction together. I appreciate that and happy to see that come forward today. Thanks.
Thank you. Next is Member Lakin.
Thanks. Thanks, Chair. Thanks, Chair. Just a point of clarification. The matter related to your motion will be addressed at a later point in our discussions?
I'm not sure what you mean by matter. Any questions?
As in
it's on the table now. If you have any questions at all around the motion, then yeah, now's the time to ask them. I mean, I can give you the background. You know, in discussions with Dr. Etches, she thought this was something that we should move forward, and we should move forward by way of a motion and with support of the board. So I agreed to work with her and bring the motion forward. And as the chair is not allowed to move motions per se, the vice chair was kind enough to move the motion on my behalf. But yes, we can take questions, and this would be the appropriate time to ask those questions.
Okay, thank you for that. First of all, thanks to all for the presentation and indirectly to the delegates. One of the things that struck me clearly and strongly with the delegates' presentation is the gap that's emerged, not just in the vaccine prioritization, but the sequencing in the wording of the current rollout, that it covers, and specifically with respect to now tapping into high risk or hotspot neighborhoods, that it covers residents of those neighborhoods, but it does not cover or make eligible the individuals that work, oftentimes in the highest risk kinds of workplaces, and in particular, those in congregate work settings, front-facing congregate work settings. So question one to either Dr. Etches or to Mr. DeMonte is whether, in addition to what's been said before, there are any concrete interim steps or recommendations to mitigate the risk that's emerged from that gap, that residents of those hotspots are now eligible, but those in working in those hotspots, especially in congregate care settings, not previously covered in long-term care residences are not covered. Could you just comment with respect to any kind of risk mitigation that's occurring in addition to the public health stuff?
Yes, I'll start, and if Mr. DeMonte wants to add anything. So let me touch on congregate settings first, because they are eligible. We have over 200 congregate care settings across Ottawa that we've identified and we've classified according to risk. The high-risk congregate settings are supportive housing, developmental services, emergency homeless shelters, other homeless populations not in shelters, mental health and addictions, congregate living, so supportive housing. Also others. I'm sorry, you get the point. I have others, there's a whole other list, again, women who are facing violence against women. So the process to reach them is a mobile option, which is currently underway, and it's rolling out based on risk. For workers in the neighborhoods where we've identified there's a high priority because of high COVID rates and often disadvantage if the communities are facing, we are beginning to look at doing workers in those areas. There is no gap in our minds, in our ability when we're in a neighborhood to immunize people who are there working or living. And this is further underlined with what's been happening in Toronto and Peel, where they are able to use workplaces in areas that are hotspots as a base to try to immunize workers and the community. And so we have been having conversations with workplaces related to some of the areas with the highest rates of COVID in our community to explore which workplaces are willing to help us out in this way. So we'll continue that approach where it's anyone who lives or works in that neighborhood. Based on age, if we don't have enough vaccine, based on supply, there's real limits here, absolute limits, but we're heading in that direction.
Yeah, and Chair, I would just add, based on what Dr. Etches initially said to the member, so yeah, absolutely, we're that's our target, that's what we're doing, and it goes with the, as she indicated earlier, a broader or a more liberal approach that we're taking in these cases. So we're not limiting. It is limited by the vaccine, but even that, as Dr. Etches said, we're using a hierarchy and a priority that would be logical.
Sorry, Mr. D'Amata, you just went on mute. The last sentence got muted.
I apologize. And I said, so we're using, as she indicated, if we have limited vaccine, even for those workers, we'll use a hierarchy that is evidence-based. And age would be one of the factors as well too. But the objective was to get all the workers in that area as well, whether they're residents or not, in the area as well.
Beautiful. Thank you very much for clarifying that. Now, this is hypothetical, but should a school be opened in that hotspot neighborhood? Would, based on your algorithm, front-facing high-risk workers in that school system be eligible in that fashion?
The answer is yes. They fall into the first group, so that they would be eligible. And again, I keep bringing this up because I think it's important for context for the public to understand. If we had unlimited vaccine, this would be a much simpler exercise. We wouldn't be triaging groups, but the simple answer, Chair, to the member is yes, we would absolutely be doing the workers in that high-risk neighborhood, the education workers, they're in the first group.
Excuse me, thank you very much. So the next question is related to Chair or Vice Chair's motion on the letter to the Premier. Do I read correctly? I'm sorry, I don't have it in front of me, and I don't need you to put it up on the screen. I'll do my best. But do I understand correctly from the wording and the language that you're suggesting that every business that is not medical, grocery, and pharmacy be closed?
That is the direction. There would be a broader list than that because there are other businesses responsible for health and safety. And again, a point to Councillor McKinney, she pointed there are people who repair elevators. That's important for health and safety, right? So there would be people who respond to critical events of various different natures. So the point is to limit the number of places where people are coming into contact with each other, and to start a more critical paring down of what is open, and knowing that workers will need income support if they're not able to work, to make sure that that is also a consideration.
Mm-hmm. This may or may not be the time to ask for your response to this. I understand that the intention is, as you described, Dr. Etches, to effectively create a true lockdown and a real restriction on the amount of social interaction that occurs. Is there an intention to, at the same time, message the importance to recognize on the vaccine front the need to enter into the sequencing factors other than age that were identified tonight? For example, congregate care settings that are not on your list, front-facing front-facing individuals, whether childcare or otherwise. I realize that's not part of the intention, but I realize there may be a delay in getting a response. So I wonder if that also entered into the thinking.
I'm not sure I fully understand your question. So the motion is about limiting contact between people in various workplaces that are not essential because we cannot immunize everybody. And so if your question is about then are we focusing the immunizing on people who are the very smaller number we hope that are still actually going out to work, there could be a connection, yes. So an immunization approach that then focuses on those that are truly not able to stay home because they're providing food and healthcare and health and safety services, that would make it a smaller population to immunize of the front-facing workers. But there is still not enough vaccine. And there is still no way that the immunization only will turn this curve. So we cannot have vaccination in our minds as a way to solve the problem that we're facing right now in our hospitals. And so maybe that's what you were getting at.
It was, and I completely understand the point that has been made several times and agree with it completely, that supply is defining the problem. But I just wonder if the corollary to a full closure would be to add a focus to the immunization strategy while in the interim to that smaller group.
We are already on that track, Member Lake, and that is
wasn't in the language, so I just didn't quite fully grasp the intention.
Is that all then, Member Lakin? Your
If I
time's
heard
just
Dr.
about
Bridges-
up, so you probably have time for one more question if you can fit
No,
it in.
if I got it was satisfied because I think I heard Dr. just said if that was the intention, that that satisfies my question.
Okay, perfect. Member Kavanaugh, please.
Thank you, Mr. Chair. Thank you to the delegates for coming out tonight. It was very heartfelt, and they obviously care very much about childcare workers, and many are suffering themselves. I have a sister who is an education assistant. She got her vaccine because she works for a school board and has to deal with special needs kids all day. And she just tells me what her day is like, holding down children that are very large. It's quite something. So I can only imagine what they go through and why it's so stressful and their concern. I mean, in terms of the long-term care facilities, one of the concerns was that it was the it was the workers who were the ones that were pretty much carrying the disease into the facilities. And so they were the essential workers that we got to quickly in terms of vaccinations. Even though children are not vulnerable directly for COVID to a high extent, but they're passer honors. Is that not a reason to consider them in a higher risk area?
Childcare workers are in the first group of people who cannot work from home. And so what you're going to see is that they will be prioritized in the first group. We just have eight categories of people to line them up against, right? So we need to take the information we've heard tonight and feed that to the group. And I'm sure it will be helpful in terms of understanding where do they fit in relation to farm workers and others working in the food system, for example.
I'm curious about the numbers because we've talked about groups, but for example, when we're comparing, an age category versus a group of essential workers, is it like 5,000 people versus 10,000 people or anything like that? Is it a numbers thing as well in terms of that? Because of the fact that we're pretty tight on the vaccinations, they come in waves, as it were. Is that an issue?
We are doing a matchup in terms of vaccine supply and then those groups that are eligible, the size of the groups, but we would still proceed through the priority groups. We just wouldn't get as far. So we'll continue to orient towards people who cannot work from home. We're not going to say that group's too big. We're going to go there, but we're only going to make so much progress based on how much vaccine we have.
Okay, thank you. I do appreciate the high priority neighborhoods. I think that was really, really important. And we were out of the gate early on that. And I think it was a success. I would like to know how it's going. Do we have numbers in terms of when we've identified these areas, such K2B area, it's not all K2B, but those areas, do we know if there's the take-up is there? Because that's another thing in terms of reaching out to people. We certainly try and advertise as much as we can. And to Member Menard's point, it's tough when information changes all the time. But how's it going for take up in those particular neighborhoods?
So the vaccine uptake we are monitoring in many different ways. We are looking at it by community, what we call quintile. So it's not plain language, but we divide the population up into 5 groups. So those are quintiles according to most advantaged to least advantaged. And we're looking at how is our coverage rate for vaccination across those different quintiles. And we're looking for as much equity as we can, if not more protection in lower, less advantaged neighborhoods who have a greater burden of COVID. We are also looking at it by neighborhood. So we have a map that is available to see how is the vaccination going by neighborhood. And then we are looking at the hotspots that those FSAs that the ministry described. And again, that is overlapping with the neighborhood-based approach, but we are monitoring vaccine uptake. And it looks like that eligibility is providing for some more coverage in those communities.
Okay, thank you. Certainly was a lot of confusion when K2V got mentioned. Everyone thought it was a typo for K2B, which is the area that I know has high needs. And I know Councillor Garrow was commenting on these things too, so I'll let him talk about that. But yeah, I was concerned about, what can we provide to those ones that tend to have a lot of essential workers, more racialized people, and that was my concern. do we have stats in terms of the number of racialized persons who are either in terms of infections or in terms of take-up?
We do, and you've heard the reports previously about rates being higher among members of the Black community in Ottawa and newcomers especially, and lower income populations. So that trend we've examined at different points in time based on dedicated data collection about people who are testing positive. I don't have an update for you today, but I would expect the trends would continue. And in terms of the uptake, this is what we're using the neighborhoods as a proxy measure for what we know about the neighborhoods in terms of their makeup of newcomers and racialized populations. We don't have a vaccine system that currently collects information about ethnicity or race. And that is a work in progress. I've seen provincial discussions and intent to add that in. But in the meantime, the neighborhood proxy measure is useful for us. It does tell us if we're getting to protect the right people.
Okay, thank you. I was curious, out of essential workers, construction sites are considered essential. Have we had any outbreaks on construction sites? And of course, we have a ton of them right now with LRT construction, new development going on.
We have had outbreaks in construction sites, and not all construction is essential. So I think that's a clear example where we can probably pare back the type of work that is happening that's leading to exposures.
Okay, thank you. I really appreciated the fact that we spoke out on the issue of playgrounds. I just felt so sickened at the idea that children would not be able to play outside. And I believe that we're talking about having recommending masks for children at playgrounds, and still try and make an effort to be apart. No, I think that's a very good idea. What about other things like basketball? I'm worried about teens and older ones.
Those amenities are technically closed under the provincial regulation, but we can revisit that in the future if there's a need.
I do worry about that for mental health, and we've seen in the past the concern. I appreciate Chief Slowly being here tonight, and the strain that it is that was thrust upon him in terms of the responsibilities. One of the success stories in terms of the last round was that we didn't use police, of course, but we had the whole system of park ambassadors, and that was more education oriented. Can I get some comment on how we're handling that now? Because I'm hearing a lot of people, you know, they see people congregated together, they feel frustrated, they can't go up and talk to them. And it's an education thing. This isn't about throwing fines at people. We know that that's pretty heavy-handed. So I'd like to get some comments on that.
Sure. And that will have to be your last question, Councillor. Your time's up, but I'll certainly let Mr. DeMonte answer the question.
So yes, Councillor, as a result of the last experience, we're repeating it again. My colleague Dan Chenier is now mobilizing the park ambassadors, and that's what we're going to be using, very much an education approach. And Chief Soley mentioned a little earlier something else, and I know he has his hand up, so I don't want to steal his thunder if that's where he's going. But our approach on enforcement this time also has been informed by Dr. Etches. We had a great meeting, Chief Soley, myself, Dr. Etches, on the weekend, of where we're going to, with the limited resources we have, where we're going to focus our energy to meet our public health objectives, not to meet enforcement objectives, but to meet our public health objectives, and how enforcement can be a tool to assist, and how we're going to approach that. And actually, quite literally, and Dr. Etches has indicated to us, you know, parks is not the area. Outdoors, as long as people aren't congregating, and if we add the masks, that's probably not where we're going to see many bylaw officers anyways, I can tell you that. It's where we're having some challenges and where we need to intervene so our public health crisis doesn't get worse than it is. So on the ambassadors, we'll absolutely have ambassadors in all the parks.
Did she solely?
Yeah, I'll just reference, Councillor, your question. In fact, when we met this weekend with Public Health and Tony's team, we were very specific, looking for not just a return to that park ambassador concept, but potentially an expansion of roles for civilian members, community members, local community and NCO members to play a more active role in the engagement education piece, ideally even in advance of or substitute for some of those efforts that I won't speak for Tony, but certainly our police officers were involved with, could mitigate a whole lot of issues, including improving the health outcomes. We were very supportive of that and would support that expansion in any way that Tony and the city team sees fit.
Okay, and next, thank you, Chief. Next up, we have Member Gower.
Thank you, Chair. One of the, all of the presentations from the delegations were useful tonight. And one of them that stood out for me was from, I believe her name was Jessica Scallon, and she introduced herself as a childcare worker who is over 40 and was unable to call in and make an appointment at a pharmacy today because she's busy looking after babies. And I would imagine a lot of people who are essential workers are in that same boat. Meanwhile, I am in my 40s and I work from home all day. Very easy for me to make an appointment. So I guess I have an ethical question for Dr. Etches, and looking for your advice to people who are over 40 or who may find themselves eligible, who work from home, would consider themselves at fairly low risk. Should we be holding off in making that call to our pharmacy to book a vaccination appointment? Should we be leaving those spots open for the essential workers of our community? What would your advice be to us?
Unfortunately, there's not one way I can answer that for everybody, because there are a lot of essential workers who also may be working from home who we need to protect. Like, there's some places where that is a role that we need. But yes, on the broad screen, like the big picture, what I would recommend, what I will do with the places I have control over is ask that the vaccine be made available as a priority for people who cannot work from home. And that could be extended if you do your own assessment of, are you one of those people who could work from home? Then thinking about the nature of your work, the criticality of the function, that comes into play. And yes, if it's you make that assessment that you have a role where you're not going to be as that your function is not as essential as some in the list, then protecting people who have to go out to work is really important.
Okay, thank you for the advice. Thank you, Chair.
Thank you, Member Gower. And now is Member El Shantiri.
Thank you, Mr. Chair, and thank you all for being here tonight, and to all the people who come up and spoke to us earlier. Dr. Etches, obviously, you said it time and time again, the problem is the shortage or the lack of availability of vaccination. That's why we're having all this debate, really. And also, when we talk about prioritize, I always feel every time we make, you make that priority somewhere, so someone else is not going to be priority. Is that correct? Like when you change in priority or shift in priority, so that means you're shifting from one group to another.
Yes, which is why we're making sure we're careful about opening up the age groups to all essential workers until we finish people over 60. But that time is approaching where we've by the end of April, we can see that we will have protected people over 60 for probably our target, at least of 70%. And so then it is a matter of balancing between the different groups. So people who cannot work from home, as well as continuing on with people with the highest risk health conditions, congregate care settings, and the neighborhoods, again, playing a key role to address places with less advantage. So we have to divide up the vaccine across these different populations.
Mr. DeMonte, and I know we talked about this in the past, talking about the folks who's homebound and, you know, with the mobility issue, and we said it's about 2,000 across the city. And I'm sure your effort and Dr. Atch's effort to get to have those folks on. Can you give us a little bit of update? I think I heard you say they are now on the list, but I want to hear a little bit more detail from you. How are you going to reach to those folks?
Yeah, Chair, to the member, yes, they are, and they continue to be one of our priorities. As Dr. Just says, I think we're there. So we're using a couple of strategies. Some of them may already have a link with healthcare workers or home visits, that type of setup. So certainly we want to take advantage of that. There's a lot of reasons for that. Already there's a relationship sometimes with a healthcare provider. So that would be the way to go. For those cases and now that are being identified that we can't do that, we will be sending people to homes for that exceptional case. So we are looking at a mobile team, a strike team for lack of a better term, perhaps of our community paramedics, that now that we've shifted and we're not using them to do the long-term care and all that because that's out of play. We've finished that these resources can be available, or maybe some of our public health nurses. But again, we're looking at targeting those groups. First and foremost, do they have some sort of home support from a healthcare provider or link? And if not, then we're going to try to fill that gap for sure. So as Dr. Etches wants something to say, but that's what we're looking at right now.
Yeah, and the community health centers are playing a role with the mobile option for homebound people.
And if I can just follow up, what about the people who, the health worker who visit, or the home care who visit those? They're not necessarily, are those folks also, they will be vaccinated at the same time? Because if you're looking after one of those individual homebound, the home visit or the home care person also on a list?
The healthcare workers have been prioritized previously. So healthcare workers.
There might not be a public, there might be just a home, I don't know what's the term, home care visitors, not necessarily healthcare visitor. Someone just go to help the individual to stay at home, cook their meal, clean up, I'm not sure if the term home care, but they're not necessarily
caregivers, like people who provide support and caregivers. Yes, those are people who could be eligible, and there's different channels for them, as well as, you know, potentially in the home.
So they need to reach out to us through the city number, or how would they make themselves known to you folks?
I think that for those individuals, they should contact the Ottawa Public Health number, and then we can navigate them through, because as Dr. Itches, some have been streamed through the hospital channel, others we can do through our mass vaccination clinics, but the best would be to contact the public health number, and we'll assist them through that process.
Okay, well, thank you very much, Mr. DeMonte, and Chief Lawler. I just want to say thank you for early on Friday, with the majority of your call across Ontario come out, especially from the Big 12 services, and make it clearly the police will not be conducting random spot checks. So I really appreciate that position you took, because you're one of the people who worked originally to expand that practice. So I was pleased to hear you came out earlier and you spoke about this. Thank you.
Councillor, thank you, Chair, if you just permit me.
Absolutely.
I want to be very explicit on the point that Councillor El-Chantiri raised. I heard it through several of the board members, certainly in Dr. Etches and her team, as well as the numerous delegations that came here tonight. And I'm grateful for the opportunity to be here and to actually have listened to those delegations and listened to this board and see it in operation. It has significantly informed me and will inform the Ottawa Police Service to a greater degree on our ability to work with the Ottawa Public Health around this crisis. But I want to be very explicit. The issue of the disproportionate impact on our communities of color, the most marginalized, often the most victimized and racialized, and I heard the term used before, often the most overpoliced and sometimes the most underserved communities, is not lost on me. In fact, it has informed the majority of my policing career. It was not a difficult position for me to be in, to make a decision to not advance any sort of an enforcement or policing or public safety outcome, but to make sure that we were laser focused on the public health outcomes that were needed here locally. And I shared those feelings and perceptions and directions with my peer group across Ontario on the calls that we had over the course of the last 3 days, and will continue to stand for that position. I am not in any way naive to believe that these comments alone will help to address the deficit in trust that certain segments of our community hold in me, my office, my organization, and my institution. I can only continue to repeat my commitment to a diverse, inclusive, and equitable police service that works in collaboration with our partners at both the city and the community level to address broader community safety and well-being issues as is legislated by law here in Ontario. We'll make mistakes along the way, but make no mistake, I am absolutely committed to an inclusive, progressive, healthy, and safe city, province, and country. But thank you for raising that, Councillor.
Thank you very much, Chief, and thank you, Mr. Chair, and thank you for the motion, Mr. Chair. I'll be more than happy to support that motion you put forward.
Thank you very much, Member Alchantieri. I appreciate that. And next up is our Vice Chair.
Hi, everyone, and thank you for your comments, Chief Slowly, and pleased that you're here as well. Mr. DeMonte, I think it is unbelievable the support that Ottawa Public Health has from the city services towards better health outcomes. I think if we keep that at our forefront, we'll all be better served. So as a worker in an acute care hospital, that we're expanding our critical care capacity in ways that we would not have ever wanted to do or predict, it is very sobering for us when we think about the projections of what the next month will come to bear. So I really do appreciate the public health measures of how we strengthen those measures so that we can actually do something to curb this current wave. We won't vaccinate our way out of this. So I appreciate, and rightfully so, a lot of thought and care around making sure that we have a smooth rollout of our vaccines and that we're truly getting to the most targeted population, but it really does need to be coupled with public health measures of to protect lives over the coming months. It is very sobering projections, and what certainly my colleagues in adult critical care are facing is unfathomable if you would have asked us just a little more than a year ago. I get emotional just thinking about it. So thank you, Dr. Etches, for Ottawa Public Health, of course, in your work to date, and for the delegations that presented. I think there was lots of compelling arguments. I always learn lots at these meetings and by the presentations. And to follow up on Chief Slowly's remarks, I was particularly happy to hear about the equity of the vaccine distribution to date. I think that says a lot about us as a city of how we've been able to really ensure equity across the populations. And so happy to hear that. And also had not clued in, to be honest with you, about the diversity of our vaccine prioritization task force. And so congratulations for putting that structure in place. I think, again, it really does support and all that Ottawa Public Health and the City of Ottawa wants to do to increase our equity there. The essential worker prioritization is challenging. It is, we've all, I think, had our eyes open to how many essential workers there are across the city that really do help us keep us going. We've all, I think, seen childcare workers. I was reminded, though, of what a foundation of infection control practices they put in place daily, to make sure that there's not viral spread. Much before COVID, they were certainly much better positioned than many of us in that knowledge. But I was reminded of the risk factors that they do face. So very similar to the special education teachers, their prolonged exposure, and clearly infants and toddlers can't wear masks. And I think that does put them in a little bit of a different scenario. You know, we've all can imagine their workplaces, but I thought that was really a good reminder of that. And I'm sure the vaccine task force will take that into place. So I think my only question for tonight is really around that pre-registration process. And I'm not completely clear as to whether that's provincially driven or whether we have control over it at the local level, that we can tailor the questions asked and actually you know, pre-register people so that when we do have the vaccines, which I understand is precarious, that we can efficiently roll that piece out.
I'll just speak first, and I know Mr. DeMonte might want to speak to the operations, but what we have control over is taking that large group of people who cannot work from home. The first group that the province has given us, and I didn't read it out, I read out only the childcare piece, but I'll just give you the highlights. It's elementary and secondary school workers, workers responding to critical events, inspection and compliance roles like our bylaw officers, building inspectors, food inspectors, animal welfare, and then individuals working in childcare, foster care agencies, food manufacturing, and distribution workers. It's an important one. Of course, all of them are, and agriculture and farm workers, and then funeral, crematorium, and cemetery workers. So what we have control over locally is prioritizing within this group, and then how we advertise and offer vaccine and bring people along till that group is completed.
So I would just add to that, and to operationalize that, once the team has identified that, and Dr. Etch just talked on earlier, based on vaccine supply and the numbers of each of those groups and the priority that'll be established as far as hierarchy, then we'll try to find a way to register them. In the perfect world, the provincial system would be able to do that. It is the system that was built. It can take big volumes of numbers. The challenge we have is the system, the way it's set up right now, doesn't have a way to distinguish between some of these people, or how do you do that? So they're currently working on that. So that said, because it's too important and because we have to continue marching on, we do have some local options that could be onerous and difficult for us. But if the province is not able to provide the solution, we will find a way to make it happen here in Ottawa, like we did in our neighborhoods. We'll be ahead of the curve, and I guess they'll eventually catch up to us. But again, it's going to be balanced off with the vaccine supply. So it's always those two dynamics that are being played forward. And to your earlier comment, thank you for it, but about the city supporting, but it really is a team effort. Vera and her leadership and her team in public health, the chair of public health, and you know, I know Chief Slowly as well too is added to that, but the entire city, we all know what we're all here for, is to get our community back to where we all want it to be. But thank you for those comments.
Appreciate it. Thanks. No other questions, Chair.
Thank you, Vice Chair. Member Cloutier, please.
Merci, Monsieur le Président. Thank you very much. And yes, I have to start off by thanking Chief Slowly, by thanking Mr. DeMonte, by thanking Dr. Etches and your teams for the work you are doing, as the Vice Chair just said, in municipalities that are delivering and assisting and answering residents, dealing with changing provincial orders, changing guidelines, varying supplies, and the medical evidence. It is very difficult to navigate this pandemic and how to make sure that we roll out the vaccines as quickly as possible. So thank you to the departments represented here and to the whole team. Just a quick question, and you touched on it a little bit with respect to phase 2, and you enumerated, Dr. Etches, the listing. In an environment where there might be a closure of schools, depending on the evidence that that the ministry will receive. How does that impact your reprioritization of that phase 2 list of elementary school, critical events, enforcement inspections, and number 4, individuals working in childcare?
The sequencing task force will be looking at exposure risk as one of the variables. And so if a teacher, for example, is working from home, that exposure risk would be less than a childcare worker who's caring for children in person. So that's one of the elements that they will use to make their sequencing recommendations.
Okay, thank you very much. That was the only clarification that I wanted to receive. Thank you, Chair. Merci tout le monde.
Thank you. Member Banham, please.
Last but not least, hopefully. So thank you, everyone. You covered off so many of my questions, so hopefully there won't be too much to say at this stage. But I was really moved by many of the delegations, but specifically 3 that come to mind, Catherine, May, and Mohammed. They talked a lot about equity and racism and the BIPOC communities and how they must be represented. And I've learned a lot here tonight about what public health and Mr. DeMonte and Chief Slowly have been doing to ensure that those communities are front of mind as we work through the situation we're currently in. But I wanted to bring it back to a previous board meeting where we all collectively came together and unanimously or almost unanimously passed a motion that racism is a public health issue. And I think we should try to remember that motion that we all came together to pass every single time we meet and every single time we consider an issue. And so I've heard a few great things that are happening with the BIPOC community in mind, but I'm wondering, I hear a lot about the province's ethical framework, and we've seen a lot of evidence that it is perhaps not as ethical in some places as it may be in others. And my hope is that we're using our own ethical framework or our own lens to ensure that we are keeping racism in mind as a public health issue. And so I know that the federal government uses GBA+. I'm wondering if we are using a evidence-based framework to really examine how we go about implementing, whether it be the vaccine rollout, whether it be our strategic plan, whether it be whatever we're doing. Do we have a method that we are using? And if not, how can we truly say what we're doing is evidence-based?
Yes, so we have an ethical framework of our own, which I think actually, I'm very actually sorry I haven't circulated to the board yet. And so I will take it as an action item to circulate our ethical framework for the pandemic response to the board. And maybe we can also make it public, put it somewhere for people to see. The ethical framework we use certainly points us in the direction that you heard some of the comments of today, that we need to consider the impact on disadvantaged populations, who is going to be most negatively impacted by any measure, whether it's vaccination or public health measures. And we need to include those perspectives in our work, in our planning, in how we implement. And that we need to promote supports to counteract negative impacts. And we need to be transparent about the process and what we're doing. The evidence base broad for how we're approaching the vaccination program specifically. I mean, we're looking at the evidence of the studies and how the vaccines work. We're looking at the expert advice from the National Advisory Committee on Immunization to inform that. We're also looking at our own evidence of, again, disadvantaged, higher burden of illness in our community. We're measuring that. We continue to measure that to evaluate our response. And we're using evidence, like you heard tonight, actually, the stories of people's experience as qualitative evidence of what it's like for people, what they're experiencing and what they need. And that's happening through on the ground work with communities that are less advantaged, town halls, and through partners who serve communities and people with less advantage. So I think you can see, again, the neighborhood-based focus that we just spoke about is coming directly out of application of the ethical framework, and it's something we'll continue to grow. And it's been part of the whole COVID response to be trying to mitigate some of the harms in the communities most affected, in partnership with others who serve those communities. The Ottawa Local Immigration Partnership, for example, is very key in looking at how the newcomer population has borne a greater brunt of the illness. And anyway, many different partners, but these are all things that I think are showing us what needs to continue as a way of working after the pandemic, to continue to address the structures that cause inequity in health in our community.
Thank you. In terms of the childcare perspective, and as somebody who will be sending her kid to childcare in a week, I'm so happy to have heard their views today. This is a profession that is filled with predominantly women and often racialized people. We send them our kids to care for them, to comfort them, to feed them when we can't be there ourselves. They take care of the kids of other essential workers, including healthcare providers. And the same group of people, women or people who are racialized, are often underrepresented at tables such as these, or governments at all levels, including City Council, especially here in Ottawa, where the power over the decisions that affect them are made. So I think what we saw today was the organization of a group of people who believe they are fighting for their lives and their livelihoods. So I'm thankful to hear from them today, and I hope that childcare workers will receive equal treatment with teachers in phase 2. And I really wanted to vocalize that pretty strongly, because I was deeply moved by what I heard today. And I know since many of those people are my colleagues, my peers, etc., I hear their pain every day when I go to work, and I have an exclusively female identity or woman identity identifying staff, and they are often having to call in sick to work because they have to get COVID tested because their kids who are in daycare were exposed, et cetera, et cetera, et cetera, right? So it affects not only the parents of the kids, but it affects their workplaces. I'm a healthcare center. We are a birth center. It affects everybody. And I don't think there's anybody, hopefully, on this call who doesn't understand that children in daycare and the parents of children in daycare are the engine of our essential workers, et cetera. So I really hope that we really think about that and that is communicated outwardly, because I think those people who were very brave today deserve a response. And if I can just add my last little comment before you have a chance to respond, I wanted to just say to Chief Slowly that I was very thankful that you talked about your personal experience and the words that you chose to share with your peers across the province. And I heard you when you said that you don't think that your comments will, be the final thing that closes the gap on the trust with the community. But I think that it's really important for leaders to understand, and I think what you said demonstrates that you understand this, that leaders must trust the people that they are working with, but they must earn the trust of the people around them. And I think what you said tonight goes a long way to earn that trust. So thank you so much.
Thank you. So that is, excuse me, all the members. I just have a few quick things that I wanted to add, and first off is to thank all the delegations that came out tonight and shared their stories and their viewpoint on these issues. It was much appreciated. It's been a long night, a long meeting, but I think we all certainly got something out of it, and we all learned something tonight from that. And I also want to thank Chief Slowly and Tony DeMonte for also coming out and assisting in answering questions. Not a normal part of our panel at Public Health, but both of you were certainly welcome anytime to provide updates or make yourself available to answer questions. I have two very quick questions, just for clarity's sake, really. And the first one is, I'm not sure, Dr. Etches, if it would be you or it would be Omar, a combination, but you did reference, I believe, Dr. Etches, when talking about Section 22 orders, the more effective or way of enforcement of a provincial order versus a Section 22. Could maybe somebody elaborate on sort of what that means and why that's relevant?
Yes, through the chair, the Provincial Emergency Management and Protection Civil Medicine Act, as well as the Reopening Act, there's a framework under that legislation. There are provisions that facilitate enforcement. So often when you're looking at the fence under the provincial legislation, you turn to those sources of enforcement rather than the Health Protection Promotion Act. So I think that generally conveys that that there's at this point in time in the pandemic, there's a provincial framework also outside the HPPA that provides authority to enforce measures.
Thank you for that. And the other question, Dr. Etches, again, just for people, if they're still hanging in there and listening to the meeting, the direction speaks the Ottawa Vaccine Sequencing Task Force, and we've spoken about that. But I think it might be helpful if you could give just a bit of a clarification about who makes up the task force.
Yeah, so I refer to it being a group of diverse individuals. It is co-chaired by an Associate Medical Officer of Health for Ottawa Public Health, who you know well, Dr. Trevor Arneson, and Health System Integration Leader, James Fahy. And then on the committee, I know for sure, we have infectious disease specialists from GEO, I believe, and probably others. Mike Kekowicz is an ethicist who is part of the Ottawa Hospital, but we have someone who was recruited from the community, was asked to put forward a representative from Indigenous community, as well as the Black community, as well as the newcomer community. And we also have, I believe, people who are from an older adult community, knowing that older adults were some of the most vulnerable population in our community, and also primary care, I believe, knowing that is also an important perspective. But I can get you the full list, perhaps. There is a terms of reference. If the board is interested, I can circulate that as well.
I think that might be helpful, and thank you for that answer. It gives a sense of it's the community, if you will, working together to make these decisions within Ottawa. So thank you for that. So we're finished with the delegations. We have the direction in place. I believe the next thing, Deanne, we need to do is to vote on the motion, and then to vote on accepting Dr. Etch's report. So on the motion, can we carry that?
Carried.
Thank you. And on, can we then receive Dr. Etch's report?
Received.
Received.
Thank you very much, everyone. Next is item number 3, which was held, which is the Ottawa Public Health 2020 annual report. We don't have a presentation on there, but we do have a delegate, and that's Zach Boissino. And Zach is still with us, I can see on the screen. So over to you, Zach, for 5 minutes. Thank you.
Thank you, everybody, for having a little bit of time to hear me out. I know it's been a long night. I'm hopefully not going to keep you any longer than I have to. Once I read through the annual report, I wanted to make some suggestions for next year. As a health professional, I think that I have a good ground to stand on to make some suggestions. I was a fat kid in high school, grew up, lost a bunch of weight. I'm very much self-taught in terms of health and fitness, but I run a small facility, private one-on-one training, and I've been in health and fitness for almost 10 years. I went to the University of Carleton for mechanical engineering and computer science. Academics understand, modeling I've done a lot of. And so when I read this annual report, the biggest thing that I saw was that the photos that were used for it were a little disturbing. There were more photos of needles than there were of exercise. There was more masks than vegetables. In the first 3 pages, the mayor, the chair, the medical officer all made statements, and there was no mention in there of exercise, healthy eating, or anything to do with genuine health. There are 2 goals that then stood out for me further to that. Goal number 2, it says communities by design. I'm not quite sure what that means, but I hope that it certainly involves some measures, like it says, to prevent infection. But what about some mandating for like healthy eating and exercise? We talk about going outside and getting your exercise, but there hasn't been much like clear direction for people that way. The CDC said that 94% of deaths had 2.5 or more comorbidities. Pops, chips, chocolate is all considered essential. Cigarettes I can still buy, and it's a little disturbing to talk about what health should be when that stuff still goes on. There's also some talk about influence for physical environment. I think that it's more important that we talk about the environment of people's GI tract and immune systems rather than continuously talking about what's been measured so far. Goal number 3 also stuck out to me. Talks about the streamlining through digitization. 93% of human conversation is nonverbal. The loss of small details and digitizing is destroying human connection. I encourage anybody here to go check out the Harvard study and to just see what they talk about in that. Further to that, there were then some highlights. And so those highlights, same thing moving forward, if next year some of this stuff were to change, I think that we could have a much better year next year than we did this past year. The highlights talked much about programs to mitigate harm, but very little mention of like preventative measures that we can be taking. It talked about some more support to communities with higher rates of COVID, but there was no support that should be directed to communities with comorbidities. That's the biggest underlying factor to the severity of this disease, and there's been very little talk about comorbidities and battling them. We talked a little bit about budget. I'm certainly no expert there, but it was good to see that there was 4.59 million for healthy babies. Who doesn't like a healthy baby? And I saw that there was 47 million for COVID. I didn't see any spending to healthy adults. What about some spending to promote exercise and immune systems or human connection for mental health that we all know is important? How about risk mitigation for junk food? How about promotion of whole foods? If you were to tell people that having a BMI below 25 was more important than masks, we would not be in this mess. The CDC of 148,000 adults showed an inverse relationship to BMI and severity of symptoms. BMJ had a study of 48,000 people, and they linked inactivity to severity of COVID. Canadian Science Publishing released a report on COVID's effects on university students and their activity. Cole's notes is that it was not very good. The NIH has a relationship of obesity to international death rates, and there's a clear correlation between those two. The NIH has also published that vitamin D is very positive for the severity of symptoms, and there's been minimal messaging in terms of vitamin D and fighting this virus. So I hope that for next year's annual report that there's far more mention this year about there being vitamin D, vitamin C, zinc, ivermectin, healthy eating. If everyone needs masks, no one needs chips and soda. Mandate a BMI of less than 25. 90% of Canada COVID cases have recovered, not because of masks, distancing, shots, or business closures. It's been because of immune systems. We need to educate people on immune systems so they can lower their stress, feel safe, and so they can feel like they can fight this coronavirus and recover, because that's what's happening. And so I hope that for next year, there is far more messaging from Ottawa Public Health to real health, not the idea that a mask and a shot is some sort of shortcut to it. And like it was said a lot today, we cannot vaccinate our way out of anything. And I don't think that we can vaccinate our way out of the responsibility to real health. So thank you for hearing me out. I appreciate you guys taking the time.
Thank you for hanging in there till almost 10 o'clock to
worth it.
Presentation. I don't see any hands up, however. Oh, we do. Sorry, Councillor Kavanagh.
Thank you. I won't belabor it, but thank you, Zach, for coming out tonight. I actually think that's the core of public health. Frankly, we're in a major distraction, but you raised some good points. Physical activity is extremely important, but and healthy eating and healthy lifestyle. And I know Dr. Etches feels that way. She's very much on that game. But I think we've been terribly distracted, obviously. But it is the core of public health, and I thank you for raising these points.
Thank you for hearing me out. I think the biggest thing, like I said, vitamin D needs to be talked about a whole lot more than it has been. And like I said, zinc has been super positive. India has had a package of pills that they've been giving out that's cost $2, and they're having a whole bunch of success with some of that stuff. And even if we were to use something like that in the interim to getting a bunch of vaccines, that might have some positive effect. And there's been very little talk of a natural way to fight this. Because like I said, 90% of people have recovered from this, not because of vaccines, not because of masks, not because of any of that stuff. And so I think that we need a little more faith, and some trust, and some education in that immune systems really do have a play in this game.
Thank you again, Zach.
Thank you.
And Member Kavanagh, thank you. With no further hands up, can we receive this report?
I got my hand up, Chair.
Oh, I'm sorry. Did we lose Zach?
I think Dr. Etches wanted to just say something, and then I have a comment about the annual report.
Okay. Dr. Etches?
Yeah, it is always helpful to have an external eye on things. So I appreciate the feedback on the photos in the annual report, and we are always interested in health promotion. The board definitely heard from us about how we had to reorient our healthy community strategy, which would normally be focused on healthy eating and active living and smoking cessation, and tackling obesity, that we have had to orient towards making sure that outbreaks are controlled and people who test positive have the follow-up. And so I think you could expect to see us getting back to these priorities as we have the capacity. And we are trying to promote physical activity as a way to make it through the pandemic with better health and mental health. So physical activity is certainly something we'll look for more opportunities to promote that, and then the healthy eating as well. I think those are good points. It's probably possible to do more of building this into the messaging that we have. And the physical environment, that what we mean there is that we are looking to actually make it easier for people to be physically active by building our city in a way that allows for people to walk to the things they need, to have the bike paths if they need them. And this work did advance this year. So we were able, through the work of a couple of very dedicated employees, to actually influence the goals and the way the official plan will guide development in the city. So I think that will have a lasting impact from this year's work.
Thank you, Dr. Etches, and Member Menard.
Much very good, interesting annual report. I don't have a question to the delegation or anything like that, but I think there was a lot of good in there as well, and it wasn't all bad. There was some excellent things. It's really a reminder of absolutely essential and important work that is carried out by this board and by Ottawa Public Health. You look at the municipal contribution to OPH's budget, and it's a reminder as well that the city very much values the work of OPH with words, but not as much materially. And we need to do that materially as well. Even in a global pandemic, we've seen spending on other resources much more than public health, when the importance of public health has been so on display through this pandemic. And I think all of us as decision makers and you know, some of us city councilors, when it comes time for that spending, we really need to think about where we put our limited resources, and public health is a priority. In the report, it stated that the need for rapid mobilization and scaling up of public health workforce in response to the pandemic greatly impacted OPH's ability to continue providing some essential services at the same service levels as before. Dr. Etch has made comments about that just now. And so I think, especially in areas of health promotion and including healthy growth and development program, as they mentioned, these are areas where we're missing out because we don't have the resources to continue those things at the same time. And I think in the future we need to recognize that is a need that is ongoing. The report also highlights that the need for mental health and substance use supports have increased during this pandemic. I'm relieved to read in the report that we've been rising to the occasion and the challenge through greater collaboration with others and augmenting access to safe injection, safe supply. But we know we've had tragic losses from substance use, and this is continuing. It's actually a crisis level all across the country now. And so I'm hoping that given the evidence, that safe supply does a better job of retaining participants and reducing illegal drug use, and that OPH is in a position to move just beyond where we've been to a truly much more broad safe supply. So I do wonder, and just one question is does OPH support towards that end a decriminalization of drugs in our city? Is that something, that a position that OPH has advanced? Has it been discussed, and is it something that we can discuss in the future? Because I think this is the overdose deaths that we're seeing.
Member, it's straying a bit from the annual report here, I think. I don't know if Dr. Etches is that's a pretty broad question. She wants to try and tackle it. I'm okay with that, but I would also understand if she doesn't feel comfortable at this juncture to get into that debate tonight.
I don't think there's any debate in terms of what we're doing around the idea of substance use and criminal approaches versus health approaches. Ottawa Public Health is focused on a health approach to substance use. What we are doing with all of our partners under the Community Action Plan for Mental Health and Substance Use that has a focus on opioids is we are taking a broad approach that was a consensus gained with hundreds of people participating, people with lived and living experience, service providers, social services and health services, where we're focusing on preventing substance use, reducing stigma so that people are able to get the help they need. We're focused on harm reduction measures and growing the way harm reduction is used as an approach wherever people seek care. And we are looking for improved coordination of mental health and addictions and social services together. And so that framework was built and included discussion about decriminalization and whether that should be forward piece or part of the conversation that's evolving. And people concluded we need all these things, all these other things need to advance further. Decriminalization is something where we don't see the local police emphasizing that they will charge people for small possessions. So in reality, that wasn't the top issue that people identified at this point in our community, but we're going to continue to look for that input around how we're addressing substance use and promoting mental health in our community under this framework with so many partners as part of the community action plan.
I appreciate that. Thank you. And I know the chiefs of police have also made a statement on this. I see Chief Slowly with his hand up, and just Chair Eglai, I'm glad you're indulging this conversation. I don't know if you've read the full report, but this is something that's in the report, so I appreciate you indulging the conversation.
Yeah, no, I appreciate that. I guess all the point I was trying to get, Member Nard, it's been a really long meeting, and this is a whole new area of discussion. That's all. And but I see that the chief, I think the chief has his hand up. Chief, if you want to weigh in.
Chair, only to contribute that, in fact, the Canadian Association of Chiefs of Police have put forward a resolution supporting decriminalization. It is not a simple matter. There's a lot of complexity in there and a lot of preconditions, including the ability for local municipalities to put in place series of efforts to support those who are struggling, as well as addressing convictions from a historical standpoint. But anything that goes towards a health outcome and advances community safety and well-being, which we believe that will be the case. Ottawa Police Service has an inspector who's leading that effort. So we're proud of our local contribution to a national discourse on this. I appreciate the chance to speak on it. Thank you.
Thank you.
Any other hands, questions, comments? Okay, seeing none, can we carry the report?
Carried.
Perfect, thank you. And next, I'm going to ask Member Gower, if you could please introduce the motion to adopt reports.
Yes, motion to adopt reports. Be it resolved that the Chair of the Board of Health verbal report, the Medical Officer of Health verbal report, and the reports titled Ottawa Public Health 2020 Annual Report, Ottawa Public Health Emergency Preparedness and Response 2019-2020, 2020 Budget Year-End Results Board of Health for the City of Ottawa Health Unit Status Report, Delegation of Authority, Contracts awarded for the period of July 1st to December 31st, 2020, and participation in the Association of Local Public Health Agencies 2021 Annual General Meeting and Conference be received and adopted.
Carrie?
Carried.
And there are no motions requiring suspension of the rules of procedure, I don't believe. Okay, seeing none. Are there any notices of motion for consideration at a subsequent meeting? Okay, thank you. Member Gower, could you move the motion to adopt the confirmation bylaw, please?
Yes. Be it resolved that confirmation bylaw number 2021-2, a bylaw of the Board of Health for the City of Ottawa Health Unit to confirm the proceedings of the Ottawa Board of Health at its meeting of April 19th, 2021 be read and passed.
Carrie?
Carried.
Carrie, thank you. Are there any inquiries? Seeing none, I will adjourn the meeting. Thank you so much, everyone. I appreciate you hanging in there. Our next regular meeting is June the 21st. And before everyone goes, before we close, just want to remind any media, and maybe there's some still out there, I'm not sure, who may be watching this meeting on YouTube live stream, that will have a Zoom media availability 10 minutes after adjournment. This replaces the post-media scrum that would normally happen after in-person meetings. If not already registered, media representatives wanting to participate can email ophmedia@ottawa.ca. Again, thank you, everyone. I really appreciate your stamina tonight, and that's both for board members and for staff who are working furiously behind the scenes to keep the information flowing. So thank you, everybody. Much appreciated.
Thank you. Thank you.
Good evening et bonsoir à tous. Thank you for joining us for this evening's very evening media availability. Thank you for your patience in joining us today. This is the availability that is meant to replace our usual media scrum following the Board of Health meetings. For viewers on YouTube, be sure to click the subscribe button on the right to be notified of future COVID-19 updates and other exciting public health content on our channel. Before we begin, please a reminder to place yourself on mute until you are invited to ask your question. And to view who is speaking on Zoom, please click on the speaker view instead of the gallery view, and that is located on the top right corner of your screen. And those with accessibility needs can pin the ASL interpreter Andrea in Zoom or follow along on the YouTube stream. So on the call this evening, the Board of Health Chair, Councillor Keith Eglai, is here present. Dr. Vera Etches, Medical Officer of Health. Mr. Anthony DeMonte, General Manager of Emergency and Protective Services. Peter Slowly, Chief of Ottawa Police Services. Andrew Hendricks, Director of Health Protection. And Svetlana Valkova, Manager of Performance and Corporate Services at Ottawa Public Health. So we'll start right away into questions. We'll be going in alphabetical order, and we will be doing 2 rounds of questions. So you will get 1 question and 1 follow-up, and I will invite you again to ask your next question. So we'll start right away with CBC Ottawa, Nicole Williams. Please go ahead.
Hi there, I'm hoping you can hear me okay. I just wanted to clarify, I know there was a bunch of talk during the meeting about really what Ottawa Public Health was authorized to do on its own versus not authorized to do on its own. So, but I just want to be clear because it was a little, I guess I just was a little bit confused. Does Ottawa Public Health have the authority to shut down businesses or things that it does not deem essential? So like fast food restaurants, certain construction projects. Could you just explain that a little bit?
Yeah, it's Vera speaking. I have sought some opinions about whether it would be possible to try to limit contact between people in workplaces that may not be so essential but are still open through an order under the Section 22 process under the Health Protection Promotion Act. And it is something we would need to explore further if the province doesn't respond to the motion that's being put forward. The preference is for the province to take this action because they have already undergone the work of identifying what are essential businesses, and they've shortened the list previously in March of last year, for example. It was much shorter, and there are probably other ways it could be further shortened. So we're looking for them to take this action to limit the number of places where COVID transmission occurs.
How, just, you know, given the actions of the province up till this point, though, how optimistic are you that they will, in fact, then, you know, finally shut down fast food restaurants, offer paid sick leave? I know that there's just a bunch of requests that, you know, a bunch of professionals and experts have asked this province that they haven't listened to yet. So I guess I just want to know what the value is in waiting for the province to maybe take the lead on this when historically they probably won't.
I think there's a good chance that they will act on this because it's clear that we have exponential growth of COVID in some parts of the province, and more needs to be done to turn that curve. And the transmission in workplaces is one of the things that many people are pointing to, and I think that that's a different policy decision than some that have been put aside, that the province has taken previously, that they would close more businesses. So I think that, again, because they've done the work of determining which businesses are essential previously, it's worth putting this before them. It would be more efficient than my team trying to understand the operations and essential nature of so many different kinds of businesses. It's not our area of expertise, and it would take a lot of work to evaluate. So I do think this is something that the government should take seriously, and I hope the board's motion adds to that.
Thank you. Our next question will be the Ottawa citizen, Blair Crawford. Please go ahead.
Hi, good evening. My question is about the motion that was passed tonight about enhancing the enforcement officer's ability to enter, investigate, and close businesses. I guess it's a bit like what Nicole just asked, but I think Dr. Etches, you had mentioned that you had problems with some of the inspectors not being able to get into the businesses. And I'm wondering if you could elaborate on what those additional powers are that you'd like to see enhanced.
So again, enforcement is not my area of expertise. We have Mr. DeMonte is on right now, but there would be certain powers to be able to enter a premise to investigate whether there was compliance with the regulations, and then also certain powers to close businesses that are not complying. These are some of the tools that could be enhanced. Mr. DeMonte.
Yes, I think Dr. Etches has described it really well. So some of our bylaw officers have had some challenges in enforcing the current regulations. There seems to be some gaps. You know, if a business is open and shouldn't, and they won't allow us to enter, and also there's rules sometimes that they have to, you know, allow us to see the documentation that they have. We've had a few challenges in a couple of cases, not all, but these would be things that would be helpful to help us. And again, and as we talked in the Public Health Board meeting, the objective here is to continue to support Ottawa Public Health in achieving all our goals of getting this community healthy again. It's not just about enforcement, but these are tools that will help enhance that.
Okay, as a follow-up question, and this concerns second doses of the vaccines, and I hate to talk about a particular case, but we've heard from a family of a man in his 90s who was vaccinated, I think on March 15th, which is maybe the first or second day of the Ottawa Public Health vaccination clinics. And he's not been able to book a second shot. So I'm just wondering what the status is for follow-up shots for people in that situation. He's not eligible through the province, of course, because he went through Ottawa.
Yeah, so my understanding is, of course, there would be quite a few people who were given their first dose before March 15th, when the provincial booking system was stood up and Ottawa Public Health shifted to using the provincial booking system for most appointments that happen, not all, in Ottawa. And so that is going to be a solution that will come through from the province into the provincial booking system so that people will be able to book their second dose. Now, everyone's record is in one single database called COVAX. So everybody, you know, there is a record that is consistent and the same across the whole province in terms of when someone's had one dose, we know it's them, we know when it was, and we know what the interval should be. So it's really more of a technical nature to be able to enable people who need that second dose to enter into the provincial booking system to be able to do it. And we understand that is a work underway that's in progress. If it doesn't come into being in time to start offering second doses, then we will reach out to people to be able to use our other mechanisms of booking people, the Ottawa Public Health team that can manually put people into the system. But we will need to communicate this broadly. Once the possibility is there, we will make sure people understand how they can get their second dose booked.
Our next question will be from your community voice, Patrick Guccione. It's all yours.
And my first question is for Dr. Etches. I wonder if you can speak to the issue of AstraZeneca and some of the apprehension out in the community. And now they've moved it down to the 40-year-old age group. What advice do you give people, and specifically even women, about taking the AstraZeneca vaccine?
So The AstraZeneca vaccine has been approved for use in Canada, and it does have a very rare but serious side effect is what it looks like. And so people need to make an informed decision about taking that vaccine, but it provides very good protection against hospitalization and death due to COVID-19. And I do recommend that people have the AstraZeneca vaccine when it's available to protect them against COVID. There is actually no, I'm understanding the link with gender or sex and age is not definitive. The risk factors for who will have this rare outcome is not clear, and so I don't have a particular recommendation for women. I understand the National Advisory Committee on Immunization will be providing an update on their assessment of who should be using the AstraZeneca vaccine very soon.
My second question is related to your last speaker in delegation at the at your health board meeting. It was the issue around immune systems, and you know there was a big lobby tonight from the childcare workers to be made a priority, but there's a lot of people in that group that are immunocompromised or have compromised immune systems. They might not be getting home care, so they don't qualify under that. They don't qualify as having a chronic condition. Are you concerned that you're missing some people that are suffering from health issues like that? And I just wonder how they can reach out or where they would be on the priority list.
So what we discussed tonight was that we are working towards a place at the end of April, very soon, where we'll have reached probably our target of 75% at least of people over in their 60s being immunized, and we'll be able to move on in a bigger way to continue immunizing essential workers or people who cannot work from home, to be clear. And we're talking about how quickly that can happen and how that large group of people will be sequenced. So that is a separate group from people who have health conditions, but of course it overlaps. So the people who have health conditions are already eligible when it comes to the highest risk group. So the highest risk group is narrower. People who have significant conditions like a transplant or an active cancer treatment. These folks are being identified by their healthcare providers, whether hospital or but some others. They are being offered vaccination mainly through the Ottawa hospital. And then we move down to other health conditions that are more sort of the next tier in terms of providing risk for COVID infection. And we'll keep going down until we get to at-risk health conditions that maybe are what you're referring to in terms of milder symptoms or not clearly more severe COVID. The concern is now with what will be the approach for people who work from home. So it's just there are these overlapping priority groups, and we have to allocate vaccine according to the different groups that we're trying to reach at the time. And what's fortunately going to happen is we will have more vaccine. We will get more, and we will be able to rely more on typical healthcare providers, primary care providers, to be able to reach more people with health conditions. So eventually people will be able to voice their concern. They have a health condition, and doctors may be able to assist that way. We're also moving down through the age groups, and again, recommend if people are concerned, if they're over 40, you now have one more channel to be able to get it through pharmacies.
Thank you.
As promised, we'll do another round of questions. We'll go back to CBC Ottawa. Nicole Williams, please go ahead.
Well, I don't have any more questions tonight. Thank you so much.
Perfect, thank you. Blair Crawford, Ottawa Citizen, up to you.
Well, if you'll indulge me with this question, because I do have a horse in this race, but it's a question about congregate groups, setting group homes. And I noticed in phase one, you were vaccinating non-frontline moderate priority healthcare workers. And yet group homes, including ones that I'm aware of that have had multiple outbreaks, haven't been vaccinated yet. So I'm just wondering how that's justified.
Yeah. Well, this is direction from the provincial government. The provincial government directed us to immunize healthcare workers, all healthcare workers in phase one, according to a document that's available called the Healthcare Workers Guidance Document, I guess, for immunization. And it did rank people from the highest priority to high priority, very high priority, and then down to moderate, I believe was the last group. And so in this moderate category, you're right, there are some people who are not patient-facing. Some of these people are critical to the operations of the hospitals, for example, and still need to be careful that they aren't taken down by virus. But what we have operating as a system to pre-register people, healthcare workers, into this category allows us to be very judicious about the number of healthcare workers in the moderate category that we are immunizing in relation to other priority groups now that the province has opened up phase two. And so we are actively immunizing people in congregate care settings as a priority. And we are using a mobile approach for that. And so we're making sure that in moving ahead that we continue to use the pre-registration system to put people who are phase two priorities forward where that makes more sense to go ahead of some of the moderate healthcare workers. For example, the special education workers was a direction to complete, and they've been moved through that system. And we're also immunizing essential caregivers associated with congregate settings through the same approach with pre-registration and then prioritizing. I don't know if Mr. DeMonte wants to add anything. No.
No, I think that's complete. Thank you.
Thanks so much.
Thank you. And Patrick Uguccione, over to you if you'd like another question.
Yeah, my question would be for Mr. DeMonte. I just wanted to make sure I understood what you said earlier. You have vaccine appointments till the end of April. And then you I think you said that of the 120,000 that you thought you were going to get, you only think you're going to get about 95,000 now. Is that right?
98,000, Pat. 98, so yeah, there's been as you know, in Moderna, there's a delay, and Pfizer too. There's we're getting less than we had thought we were going to get, and that's kind of the ebb and flow that's been happening right now. And this is not just Ottawa; it's other areas of the province. So it creates a bit of a not a challenge, but we wanted to continue moving this operation forward, and we had a good momentum. So now it puts us in a bit of a lull, a little bit, not as many as we could vaccinate. And you heard the discussions tonight at the Public Health Board. There's demand, there's pent-up demand, there's groups that want to be prioritized, but unfortunately it has to be weighed against the amount of vaccine that we're going to have.
And at the point where you have 98,000, where are you in the priority? Like, are we still doing ages, or are we getting into some of the?
Well, as Dr. Etch has indicated in the Board of Health meeting, we've pretty much almost will probably be close to completing our targeted objective of 16 above, which is great, which is the age. And now we're going to start pivoting a little bit the strategy, which is was part of our strategy into other high risk groups. So we're kind of, you'll start seeing a change. Age is still is important. We're going to go with high risk groups. And that was pretty much the debate tonight about, you know, all sorts of different groups, et cetera, and the prioritization. So we'll be following the lead of the group that's looking at here, of how we'll prioritize, and we'll balance that out based on the vaccine we have, how we get to those groups and how quickly we can get through them. So some of these groups are you know, fairly significant in size. So it'll take a little bit more time, but you know, I did pick up on a comment Dr. Etches said, you know, we will get out of this phase as well, and we'll start seeing some more vaccine arrive. So the machine is ready. It's working really well now. And so while we may have a little lull, we know that when we start seeing significant vaccine, the team is ready to take that on and start marching through the, you know, more of the population.
If I could just ask another quick question. After the 98,000, like, can you see that far ahead? Like what?
No, so that's the stretch we have. That's till about the 11th of May. We do have predictions after that, but generally, you know, those are still very fluid, for the lack of a better term, and it's based on what the federal government's telling the provinces, and there's a lot of not ambiguity, but a lot of uncertainty, so that's not confirmed. So we're very, very careful not to message and not to put bookings in the system that we don't have confirmation yet. So, and this is normal. I don't want to create a thought that this is exceptional. That's about the timeline that we normally get. So, and as soon as we get additional confirmation, then we proceed doing our planning based on that.
Thank you very much.
Thanks.
Thank you very much, everyone. Thank you, colleagues of the media. Thank you, Chair, Dr. Etches, Mr. DeMonte, and everyone and Chief Slowly, and everyone who stayed on so late. Have a wonderful evening.
Our proven installation process ensures your gutters are